federal official for the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. I'm delighted to welcome you here today to the second day of the Commission's inaugural meeting. Before we begin what will be another remarkable day, this is a Federal Advisory Committee that operates under the regulations of the Federal Advisory Committee Act. The Advisory Committee process ensures independent review in an open and public manner with opportunities for public participation. I'd like to share some operational guidelines that will make sure that all voices are heard. We need your cooperation in organizing communications to the Commission. For members of the public and those joining us via the live stream, we will not be having oral public comments at this first meeting, but we will be accepting written comments throughout the entire process. We want to ensure that the public has an opportunity to engage with us, and the process is transparent. You may submit written comments to AA NHPI Commission at hhs.gov. These will be shared with the full Commission for their consideration. It is now my honor and privilege to introduce our first speaker, Lisa Pino. Lisa is the Director of the Office of Civil Rights at the U.S. Department of Health and Human Services with a long career in public service. Most recently, Dr. Pino served as the New York State Department of Health Executive Deputy Commissioner, a first-generation daughter of immigrants and first college graduate in her family. She began her career as a legal aid attorney in the Southwest, protecting the rights of migrant farm workers. Director Pino, welcome.
Thank you, Emmeline. My name is Lisa Pino, and as Director of the Office for Civil Rights within the U.S. Department of Health and Human Services, I would like to extend a warm welcome on behalf of Secretary Javier Becerra to everyone who is joining us for day 2 of the inaugural meeting of the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. I want to first start by congratulating our newly sworn-in commissioners who represent the rich diversity and strength of the AA and NHPI community, and whose expertise will be an invaluable resource to HHS and the Biden-Harris administration. It is an honor for both the White House Initiative and President's Advisory Commission on Asian Americans, Native Hawaiians, Islanders to be housed here at HHS, where they were first created under the Clinton administration over 2 decades ago. Last summer, HHS Secretary Becerra tasked the Office for Civil Rights, or OCR, with housing both entities. And as the director of OCR, I am so proud to welcome this commission to the HHS family. With the rise in discrimination and bias against AA and NHPI communities over the past 2 years, we must use every tool available to make communities safer. And this includes the use of civil rights enforcement. That is exactly what the Office for Civil Rights aims to do through our work to enforce federal civil rights laws that protect Americans from discrimination. Housing this new initiative in OCR is a recognition of our agency's strength and leadership on so many critical issues, including language access, civil rights, and equity, issues that are integral to this administration's work to advance racial justice. Additionally, the inclusion of the Commission within HHS emphasizes the need for AA and NHPI community voices and partnerships to be included in our efforts to drive this change. We at HHS stand with AA and NHPI communities and look forward to working with this Commission to ensure that we take meaningful steps toward protecting and promoting the civil rights of AA and NHPI and all Americans. The outcomes of the Commission's deliberations today will help to provide insight into the issues and challenges faced by AA and NHPI communities and identify steps to address them. It is my hope that this inaugural meeting will help to lay a strong foundation for innovative and lasting efforts to create meaningful change for AA and NHPI communities across the country. Thank you. And now I would like to turn it back over to Emmeline.
so much, Director Pino, for your very meaningful remarks. Our next presenter is Crystal Ka'ai, the Executive Director of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, and also the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. Crystal?
Thank you, Emmeline, and thank you, Director Lisa Pino, for your inspiring remarks. The Office for Civil Rights is home to both the White House Initiative and President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, and we are so grateful for your tremendous leadership and support. Before we kick off what will be another jam-packed day, I want to wish a very happy birthday to two of our incredible commissioners, Louisa Blue, whose birthday is today, and Aijen Poo, who will be celebrating tomorrow. I know there are probably a million other things that you would rather be doing on your birthday than sitting through a 5-hour Zoom meeting, but we are grateful that you are both with us and wish you both a very happy birthday from our entire team. As we kick off day 2 of our inaugural commission meeting, I want to give a quick recap of yesterday's meeting. All of you made history yesterday by being sworn in by our Vice President, Kamala Harris, who is the first woman, first Asian American, and first Black Vice President in history. You heard remarks from our 2 amazing co-chairs, Secretary Javier Becerra and Ambassador Catherine Tai, as well as other senior administration officials like Ambassador Susan Rice. And our fearless Chief Commissioner, Sonal Shah, led us through several discussions on some of the immediate challenges impacting the Asian American, Native Hawaiian, and Pacific Islander community, including the need to address the health and economic impacts of the COVID-19 pandemic that have taken a devastating toll on our communities, to combating the alarming rise in anti-Asian hate, to examining the threats of climate change and its impact on our communities. Yesterday, you also learned more about the structure of the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call PACAANHPI, including its federal interagency working group and regional network, and opportunities that you can work more closely with these entities. You've also heard from former commissioners who spanned 4 different presidential administrations dating back to the 1990s, who shared their insight and best practices on how to tackle the work ahead. And we ended with a great session in which you were able to brainstorm some of the different subcommittees you would like to form and topics you would like this commission to address in the months and years to come. As I mentioned to you yesterday, we all know that these are not issues we're going to be able to tackle in the course of just a few hours or even a few days. But throughout your tenure as commissioners, you will have the ability to take decisive and meaningful action on compiling recommendations to the president that will help to advance equity, justice, and opportunity for Asian American, Native Hawaiian, and Pacific Islander communities. We have another incredible lineup of speakers today who will be discussing some of the systemic issues impacting our community. And so without further delay, I would like to introduce our Chief Commissioner, Sonal Shah, to kick off today's proceedings. Sonal.
Thank you, Crystal, and happy birthday, Louisa and Aijen. So excited to be back here with everybody. Welcome to everybody that's joining us on the live cast, and also, of course, the commissioners. And thank you for taking so much time yesterday and the great questions, and really looking forward to today. So Crystal gave us a great recap, and what I'm going to do is go through just our charge for today. Next slide, please. Today, we have to secure our understanding of the federal infrastructure, so we'll talk a little bit more. We have some great speakers coming today. We're going to learn about the systemic challenges, and we're especially going to go deep on data disaggregation and language access, and then what the federal response has been and recommendations from subject matter experts. Next slide, please. So our goals for the meeting, we'll hear from our subject matter experts regarding the issues and challenges, and then for AA and NHPI populations. We want to understand how federal agencies are doing or to actively support and advance equity, justice, and opportunity for AA and NHPI communities. And most importantly, we need to start mapping out our work over the next 12 to 20 months. We'll have quite a bit of time today. We'll have the last hour of our time together to work on that and decide how we want to approach the 7 priority areas in our charge and chart the options for developing recommendations addressing these 7 priority areas. And commissioners, I just want to make sure that we keep, and because the 7 priority areas are written into the executive order, I want to make sure that, other things that we want to do, we should also see if we can link them to the priority areas and make sure that we can address the charge that we do have to. Of course, we can do more, but we should also do the charge that we have been given by the president to make sure we can deliver on that. So as we move forward, next slide. I think that's all of our slides, if I'm not wrong. Oh, a few more. Establish subcommittees. This is going to be the hard part. We have to do more work to develop recommendations for the full commission to consider. And as you know, these subcommittees, we can also serve on several subcommittees, but recognize that we're going to have to work pretty fast to get some recommendations. And these are rolling recommendations again, not one set of recommendations at the same time. We need to identify chairs and the commissioners for each of the subcommittees. And let's keep in mind that there's likely a chance that even within subcommittees, things may overlap and things may cross over. So we will manage to that. And also we can obviously sit in on each other's subcommittee conversations. And then we want to articulate issues for which we would like to receive additional research, information, presentations. We started this process yesterday. Thank you for all of the time that you all gave. We'll do more of it today, but to make sure that as we do our subcommittees, we can make sure that we are keeping track of everything that's happening, but also make sure whatever extra we need, we're putting it out there so we can also start reaching out to the different groups within the White House and across government to make sure we can get the briefings that we need. So again, this is a prerogative that we have and we should use. We heard from a lot of people yesterday, a lot of experts, and today we're going to hear from more. So keep that in mind. We do have to establish our subcommittees, identify the chairs and commissioners that will be on the subcommittees, and also identify what other issues that we would like to get more research on. So let's keep moving forward. I'm looking forward to a very fruitful day today. I know we're going to be busy and I know we're going to keep you long. We've got 2 days that have been busy. So let's, I'm going to go ahead and get started for our second day. So it is my pleasure to moderate this next panel where we are again looking at systemic issues impacting our communities. And it's about, largely it's about data disaggregation and language access. You will have time to ask questions. You will have time to hear from experts on the work that is being done, and both within government and also outside of government in this next panel. So I hope you will continue to ask the great questions that you have been asking. Our first panelist is Dr. Alondra Nelson. She is the co-chair of the White House Equitable Data Working Group. No better person for this conversation. And she's the inaugural Deputy Director for Science and Society, both in the White House and the Office of Science and Technology Policy. Dr. Nelson is also a Harold F. Linder Chair and Professor at the Institute for Advanced Study, an independent research center in Princeton, New Jersey. Please welcome Dr. Nelson. And Dr. Nelson, it's so great to have you here. Thank you for taking the time.
Thank you very much, Chief Commissioner Shaw, for that introduction. And I'm delighted to be here on the special occasion of this inaugural meeting of the AA and NHPI President's Advisory Committee. So I'm going to talk a little bit about the work of the Equitable Data Working Group, which is so central to the Biden-Harris administration's equity agenda, and also so central to advancing an equity agenda for many communities of color. Next slide, please. So just at a top line, just to remind you, although I'm sure you don't need a reminder, that one of the many historic things about this administration was a day one executive order advancing racial equity and support for underserved communities through the federal government. Equity and this executive order means the consistent, fair, just, and impartial treatment of all individuals, and notes in particular communities of color, rural communities, veterans communities, LGBTQ plus communities, and others. And notes, importantly, that a first step, and this is a quote, to promoting equity in government action is to gather data necessary to inform that effort. So this executive order on equity moves forward with an understanding that one needs to have a kind of baseline of understanding about what's going on in the world of federal programs and policies, as well as a baseline that helps us understand how we're doing, or how well we're doing, or how we could be doing better. The necessary data referred to here also includes disaggregated data that can help government, communities, and researchers to better understand specific demographic characteristics that both reflect and influence people's lived experience. Next slide. Thank you. In particular, the executive order stood up the Executive Equitable Data Working Group, which is really a kind of first of its kind body devoted to issues of equity in data, and gave us our charge, which was to consult with agencies about existing federal data, to recommend strategies for addressing deficiencies, and to support ultimately agencies and their action plans to measure equity and capture the diversity of the American people. Next slide, please. So we had there's some clear challenges for equitable data. And I know, I've learned a lot of this from my colleague, Karthik, who's on the line, so I'm sure we'll have much more to say. But it's one thing to have data. It's another thing to have the data that you need to answer questions about equity, to make equity assessments, and to be able to ask questions about communities that have not been always fully seen in the sort of data landscape of the federal government. We know, of course, that federal data are often not available in a disaggregated form, disaggregated by race, ethnicity, sexual orientation and gender identity, disability, income, region, veteran status, and other demographic variables. But we found early on in the work of the working group that there were several categories. So it's not just we don't have the data. There were some particular kind of nuances to the ways in which we didn't have the data. So in some instances, data was underutilized. So it might exist somewhere. People don't, or people, and maybe it's not well known, or there are barriers to using the data that are organizational culture. They could be statutory. There could be the spectrum from how people have done things in the past and how that shapes how they imagine how they can use data in the future, to actual kind of statutes and regulations that put possible constraints on the use of data. Sometimes data isn't accessible, so it can be used. The sort of data landscape often has been constituted with a few kinds of agency statisticians and sometimes a few handful of academic researchers in mind. But it's clear from the engagement that we've done that government has a responsibility to share in a privacy-preserving manner to the best it can through visualizations and dashboards and other things, data to the American public variously. And so there's also accessibility issues with regard to data based on different legitimate user communities. And then there's missing data that doesn't exist at all. Either it's very low in quality or we just don't have the data because no one's ever asked. So those are some of the challenges that we face with regards to equitable data in particular. Next slide, please. So we've tried to move forward with how to think about, to begin to think about how we would address these kinds of challenges and barriers. And part of the work of the Equitable Data Working Group will be to sort of accomplish a vision for what equitable data might be and what it could do. And so one vision could be to characterize the experiences of groups that are currently concealed in the data. And this is obviously a significant problem for parts of the AA and NHPI community. Conduct equity assessments about government benefits and services. Are these services and benefits reaching the communities who need them most? Who are they reaching? How are they reaching them? And to provide a range of communities with access to equitable data and formats that are useful to them, as I intimated before. Principles of equitable data will also require that members of the public, of course, not be harmed or made increasingly vulnerable by the use of data analytics or data sharing. And also that the data is intersectional, that we have enough demographic variables at the scale needed and at the detail needed. So the kind of intersection between the granular and the large scale, both for having detail and having statistical robustness, is one of the sort of challenges, and also one of the great benefits of equitable data as we work to really accomplish it in government. Next slide, please. So we've been going, we started meeting, I think our first meeting was the March 29th. We met for the first time at the end of March of last year. And our approach has been multifaceted. And I'm just going to talk you through briefly what we've done. And it's included agency and department consultation, a significant public engagement, a review of some of the relevant work, and a case study approach. Next slide, please. So part of the equity executive order required actually that we do assessment plans. And so these assessment plans were required agencies and departments to spend 200 days looking across their programs and policies for whether or not there had been, or whether there are, and to what extent there are systematic barriers and the ability for underserved communities to access services and benefits. And part of this tasking of the agency assessment plans was a question about data. And there were questions about data-related challenges, barriers with regards to getting data for equity assessment. And so part of our consultation was getting feedback from agencies about the data barriers that they're seeing in their work. Also within the interagency, there are sort of interagency councils, and we spent lots of time in discussion with bodies such as the Chief Data Officers Council, the Interagency Council on Statistical Policy, and the Evaluation Officers Council to sort of learn, these are the folks who know data structures, who know where data is or where data is not, who are, working in the day-to-day with the barriers and challenges on the ground. And then lastly, we worked and continue to work in consultation and collaboration with other executive office of the president working groups. So there was an executive order on diversity, equity, inclusion, and accessibility in government that, gave us some guidance around how we should be thinking about equitable data issues. Of course, the General Gender Policy Council released a few months ago their national strategy for advancing gender equity. And part of that strategy included issues and attention to being able to access intersectional data for equity assessment. And of course, as you'll hear from my colleague, Kimberlyn Leary, we work very closely with the Domestic Policy Council, who's our partner in this work and who really is driving forward the equity agenda in the Biden-Harris administration. Next slide, please. Our process has also included public engagement, including with many of you present on the advisory committee, and I'm sure watching online, including a wide range of AA and NHPI community organizations, research organizations, nonprofits, and the like. And we continue to do this, but we did this fairly regularly. We had what we called office hours. And so we all committed on the working group to set aside time every week to have this public engagement. It is a crucial part of our work. So thank you for those who took the time to engage with us in this process. Next slide, please. And then we were mindful of relevant work. This executive order in January of 2021 was not the first to point out the sort of disaggregated data challenge that faces us. And there had been important work. Some of you were involved in some of this important work in the Obama-Biden administration, including a 2016 white paper on best practices for federal data and disaggregation of federal data for Asian Americans and Pacific Islanders. Which is just to say and plant a flag that, we have learned a lot from work that has come before us, and we didn't have to and certainly didn't think we needed to start from the very beginning. So very much a part of our process has been drawing together and learning from these existing work that include, great recommendations and help us to think about on the government statistical side, how we get to statistical robust estimates that are, for small samples often that also protect confidentiality. And that really has been our guardrails and our sort of North Stars as we think about this work. Next slide. And then we've been carrying out a case studies approach. So I think one of the things that makes equitable data, a vision for equitable data, a little bit different is that clearly, state and local and federal governments, face all sorts of challenges with regards to data as we become a more data-centric society and as we understand how important data is for really understanding the world around us in new and different ways. But it's also the case that kind of solving the big data problem doesn't necessarily solve the equitable data or the disaggregated data problem. And so we proceeded with a few case studies led by folks in the working group, working with colleagues across the interagency, offering opportunities for sometimes agencies that hadn't worked together to think together about important priority equity questions for this administration and what data, what relationships, what networks we would need, networks across agencies to answer them. And so we stood up a few different case studies groups, and this I don't have answers for you because this work is still ongoing, but it has allowed us already to identify, areas of friction where we need to get to move forward, to have breakthroughs with regards to, MOUs between agencies around data sharing, cultural practices in organizations that have just never worked together before and the like. These case studies were stood up around questions with regards to disparities and inequities by race, ethnicity, SOGI, disability, income, and other variables with regards to participation or not in economic stimulus programs, and an understanding that opting out actually tells us something about equity. Why are people, not choosing to participate? Broadband access in rural areas, disaster relief and assistance, unemployment insurance, and COVID-19 outcomes. And again, this work is ongoing, so I don't come here to offer any answers yet, but to let you know that work is underway to really be able to drill down on these important priority questions for equity. Next slide, please. So as I said, the case studies examine specific questions and challenges. What we've seen that through the work that we've done so far is that, this work can inform our broader recommendations because they point to very kind of specific challenges and barriers that are occurring across government and that we hope can be incorporated into longer term agency policies and practices. Ultimately, we hope to be able to use these case study models and the relationships that have been built, the working relationships and the process of standing them up to facilitate institutional change. And lastly, the case studies have really been to demonstrate proof of concept. If we had the data, how could we use it to answer these really important questions, important for equity assessment, important for, ensuring trust in the work of government, and really important for underserved communities as well. Next slide. We can move forward. Thank you. I've said that. Next slide. So a few kind of high-level lessons learned. One is that it really matters to have presidential prioritization. That the president really, on day one, saying that this is important, has really galvanized the interagency and has helped to really drive and galvanize our work. So the commitment of this president and vice president to this work has been really central, I think, to helping us move forward and giving people the motivation and the inspiration in the interagency to sort of move forward to try to solve some of these challenges and to figure out solutions to some of the barriers we face to disaggregated equitable data. We continue to work together with community experts and the non-federal research community as part of the work, and we know that this is really important because, as I said at the beginning, that federal disaggregated data is not just for federal statistical agencies. And so, hearing use cases, communities' aspirations for the data, academic researchers' aspirations of the data, there are lots of different sort of demands there, but we're very much learning that, how to think about those together and not prioritizing, for example, the academic research community as the community that should be addressed with regards to equitable data issues. And some of our data infrastructures have been set up with that community in mind. And then, of course, it's going to be tremendously important to support an incent, kind of collaboration between all levels of government. So federally between agencies and departments, which we've been accomplishing in the case studies, but also with state and local jurisdictions. A lot of the challenges we face with data is because it sits in a kind of patchwork between different types of jurisdictions. And so building those relationships and partnerships is one of the big takeaways so far. Next slide, please. So the work continues. We are drafting some initial recommendations to Ambassador Susan Rice. The case studies, as I said, the work continues there. And out of the case studies, we've also spun up a few kind of sort of special projects. One around beginning to build a catalog of currently available disaggregated AA and NHPI data, building in part off of the 2016 work that started in the Obama administration. There's an ongoing work on improving demographic variables for the collection of SOGI data on benefit forms. There's a group of colleagues working together who call themselves the Rural Data Collaborative has been stood up to, similar to some AA and NHPI communities, rural communities, and those things often intersect, face challenges of small sample sizes, both how to preserve people's privacy, and also how to sort of get to statistical robustness. And so this Rural Data Collaborative is really trying to drill down on some of those problems. And then lastly, there's a group that is working on mapping and assessing equitable access to services in flood-prone areas. Obviously, a very important issue as climate change continues to happen all around us. So next slide, and I think it's the last one. Yeah, so thank you very much. It's been an honor to be able to tell you a little bit about our work, and I hope that you will stay tuned as we are able to say more about the recommendations that we will make to Ambassador Rice in the weeks to come. And over to you, Commissioner Shaw.
Dr. Nelson, thank you so much for this presentation. And I just want to echo what Ajahn Poo just put in our chat, which basically says that this is a really big deal that the government is doing this. The federal government is leading this effort. Having worked in 2 administrations, I will tell you that we've talked about it, but what you all are implementing is pretty incredible. And this has a very long-lasting impact once as the work you're doing is not just about collecting information and the research so you know what's happening, but that you actually have a plan for implementation. So thank you for the work that you're doing, and really looking forward to engaging with you as the commission continues to move forward and as we set up our working group. So I appreciate that. Next, I want to bring our second panelist, Dr. Kimberlyn Larry, who is Senior Policy Advisor on the White House Domestic Policy Council, where she works with the Racial Justice and Equity team to implement President Biden's equity agenda. Dr. Larry will share her perspectives on how the Domestic Policy Council interacts with this work and its alignment with the goals of the commission. Please welcome Dr. Larry. Dr. Larry, it's great to have you here. Thanks for being here.
Thank you so much. I am completely delighted to be part of this inaugural meeting. And I wish to acknowledge the groundbreaking leadership of Erica Moritsugu and Crystal Kahai. I also want to thank and acknowledge the members of the commission for your leadership. Now, what I'll be doing is zooming out a little bit to talk both about the Executive Order 13985 and some of the way in which we have been implementing that executive order, and then also try to put that in the context of how we understand in the administration what a commitment to equity and advancing equity means. So I had the opportunity and the honor really to start working on this work at OMB as a senior equity scholar before moving over to the Domestic Policy Council. So I've had a chance to see both sides of the house, if you will, as this executive order has been implemented. And as you know, within hours of taking office, the president charged the whole of the federal government with putting racial justice and equity at the heart of its work. And I think what's really essential about the executive order is that it affirms that it is the duty and responsibility of federal government to serve the public, both effectively and equitably. And the executive order included a number of components. You've heard about one from my colleague Alondra about setting up the Equitable Data Working Group. But in some ways, another really two key elements of that executive order are the requirement for agencies to engage in equity assessments. That is, to evaluate whether key agency programs, and I would mention this is not all agency programs, but key agency programs, to evaluate whether they create or exacerbate barriers to equal participation for underserved communities. And it's worth noting that this is actually complex work to do. The executive order asks agencies to shine a spotlight on the things they haven't done so well. That is, the barriers, gaps, and obstructions that burden communities of color, LGBTQ plus people, people with disabilities, those in rural communities, communities facing persistent poverty and inequality, and to spotlight that work. And having spotlighted where those barriers exist in key programs, the second thing agencies were required to do was to identify actions for addressing those barriers, and also to include metrics and accountability systems to ensure that the agencies develop, all of our federal agencies, develop equitable outcomes in communities. That was the goal, not just to address equity in the agency, there's another executive order on diversity, equity, inclusion, and accessibility, but to look at how the agency was performing in its mission of delivering equitable outcomes to communities. Disaggregated data and data strategies are clearly critical to this. And AA and NHPI communities have understood this truth for a very long time. And the limited data disaggregation of the federal government has too often erased the disparities that many in Asian American communities face. Data is also crucial for equity assessments, as Alondra mentioned, and data is absolutely essential for determining whether or not the mitigating actions agencies will implement will actually reduce barriers to equity. But let me zoom out a little bit further still to talk about systemic forms of injustice and how they're often anchored within systems in which exclusionary regulations may be baked into everyday administrative procedures and protocols. And while some policymaking, we can all appreciate, can result in unintended consequences, I think it's fair to say that systemic injustice can also reflect intentional human choices to use policies and regulations to discount or harm others. So the executive order recognizes that systemic inequities, including across the federal government, can also flourish in practices that might appear to be neutral on the surface. So, for example, programs that provide services for those in underserved communities might be weighted by higher levels of administrative burden. For example, complex, confusing, or repetitive requirements in order to access services than other kinds of programs that are more likely to receive universal use. And these burdens particularly impact AA and NH and PI communities, especially for families that may have limited English proficiency, are experiencing poverty, or are first-generation Americans. And often we may not see these barriers. Some might say we choose not to see these barriers, but we may not see these barriers because they are so deeply embedded in systems as to be nearly invisible. So the executive order is aimed at, through these equity assessments, of trying to make these barriers more visible. And then not just relying on the agency to do that, but inviting agencies to work closely with stakeholder communities, including to learn about barriers to equity, but also in some cases to be part of the process of designing mitigating actions. And I think it's also worth noting that while systems contribute to systemic injustice, they also can be uniquely positioned, and the federal government is certainly uniquely positioned because of its scale and scope to drive scaled change if the right mitigating actions are rolled out across the system. So in agencies over this last year, they have in fact mobilized swiftly to meet the considerable and rigorous timelines laid out in the executive order. And they did this in a couple of ways. I'll just say a couple of elements. They created agency equity teams, and they had guidance to include chief data and evaluation officers, frontline staff, and also, as possible, senior leaders. I mentioned that the executive order specifically calls on agencies to engage with advocates and with stakeholders and communities. And many agencies, in addition to the Office of Management and Budget, have launched requests for information, held listening sessions, challenge competitions, and a variety of stakeholder engagement initiatives. And then the agencies also had to begin to, in addition to that assessment, begin to think about, if given X barrier, what is Y action that will reduce it? Perhaps not right away, government takes time, but over time, and in a way that can be demonstrated over time to communities. Again, it's important to remember that this is a whole of government approach. And during this whole of government approach, we also recognize that agencies were in the position of learning. They're in different places in their journey around disaggregated data, different places in terms of their capacity to conduct equity assessments. And so in recognition of that, we try to create opportunities for agencies and their equity teams to learn from one another and to share best practices. And I would mention in that regard that there was a learning community that OMB launched for federal agencies, members of equity teams, that included well over 20 executive education style sessions and programs. Some were from fellow federal colleagues who were sharing best practices, and others were from those outside of government. One of our training sessions for federal employees was specifically on how to address the needs of AA and NHPI communities. And I'm proud to say, on behalf of the Domestic Policy Council and Ambassador Rice, who directs the implementation of this executive order, that on January 20th, we reached a major milestone. After conducting equity assessments over the course of 2021, over 90 federal agencies have now submitted equity action plans. And we are busy reading each and every one of those plans. I'll say more about that as we go on. But I just wanted to share a few examples of how the administration's actions, including but not limited to the executive order on equity, are changing the way in which the executive branch and its agencies conduct business. So the administration, as you know, has prioritized equitable spending in the American Rescue Plan and other pandemic relief efforts to ensure that federal help is getting to those who need it most. For example, nearly 5 million Americans gained health insurance with subsidies provided by the American Rescue Plan. Approximately 66% of Black uninsured adults may now have access to zero premium plans, and 76% can find a low premium plan. And among Hispanic and Latino uninsured adults, 69% may have access to a zero premium plan, and 80% may now be able to find a low premium plan. And the American Rescue Plan has also lowered or eliminated health insurance premiums for millions of lower and middle income families enrolled in health insurance marketplaces, including 197,000 uninsured AA and NHPI community members. The ARP was projected to reduce poverty by nearly 22% in AA and NHPI communities through increases in the value of supplemental nutrition assistance program benefits, through direct relief payments, and through extension of unemployment insurance extensions. And the expansion of the child tax credit has kept 3.6 million children from poverty. And that program cut the poverty rate among Black children by 22%, Hispanic Latino children by 28.9%, and AAPI children by 23.4%. Now, These achievements and presidential commitments, I think it's important to recognize, are not the end or the culmination of this work, and nor are the submission of these agency equity plans. In fact, the significance of them is that they position the federal government to drive towards equity for years to come. And we've certainly recognized in our work with agencies that rooting out systemic racism isn't a one-year project. It's a sustained commitment. And our ambition is for equitable policymaking practices to outlast this administration, to become a part of the DNA of how the federal government does its business. And that's why one of the major focal points of our first year in office has been to build capacity within government for equity work, to create, as we say, new muscle for agencies to identify and respond to where their programs and policies perpetuate unfair outcomes. And second, having built this equity muscle in this second year and going forward, we'll be able to flex those muscles in new ways, including through implementing the bipartisan infrastructure law. And the infrastructure law is a once-in-a-generation investment in our infrastructure and economic competitiveness. It's also an unprecedented opportunity to embed equity in how those dollars are spent and ensure that the federal dollars redress the harms of discriminatory development and divestment in communities of color in the past. This includes addressing the harmful infrastructure projects that cut predominantly and historically Asian American neighborhoods off from opportunity and ensuring that those communities benefit equally from new funding opportunities and job creation. My colleagues and I are, as I mentioned, quite busy right now reading the 90 agency equity plans that have come in. We are analyzing those plans, and we are looking forward to an opportunity to share key lessons learned after our analysis is complete. Thank you very much for the opportunity to address you and to share what I think has been certainly one of the most personally meaningful professional experiences of my career, to be a part of the implementation of this executive order.
Dr. Leary, thank you so much for giving so much detail about everything that's happening within the Domestic Policy Council. And just for our commission to know, when OMB does something, it's actually really important in the U.S. government because everybody pays attention to what the Office of Management and Budget wants. So the fact that you come from there to the DPC is a big deal. And the work you were doing there is super important, but also the work you're doing at DPC. And thank you for emphasizing how this is going to become long-lasting across government, the way y'all are approaching it. So I know we'll have a lot more questions for you. I don't know if we're going to get to them all today, but I really hope we'll get to continue to engage with you. We've got one more speaker before we go into questions. So I'm going to go ahead and introduce Dr. Karthik Ramakrishnan, who is the founder and co-director of AAPI Data and a professor of public policy at the Center for Social Innovation at the University of California, Riverside. He also serves as the executive director of California 100, a statewide initiative focused on building a vision and strategy for California's next century that is innovative, sustainable, and equitable. Dr. Ramakrishnan will share more about his work on data disaggregation and recommendations for how public-private partnerships and government can do better to capture data on AA and NHPI populations. Karthik, I am going to call you Karthik because I know you, and I really appreciate your coming on, and thank you for all the work that you have been doing. You've been out there talking about data disaggregation and doing it for a very long time, and we're grateful to have you here.
Well, I'm going to call you Commissioner Shah. Thank you so much, Commissioner Shah, for this opportunity, and happy Lunar New Year, everyone. Just so honored to be following these amazing, high-powered speakers and to share space with you all, Commission. I'm also chair of the California Commission on APIA Affairs, and I see that one of our commissioners is also on your body, so we look forward to working with you in multiple ways. Data disaggregation and data equity have been key priorities to advance AA and NHPI community needs for decades. Without detailed, accurate, and timely data, our communities are rendered invisible and misunderstood. And these misleading narratives end up harming our communities in many ways, including insufficient attention, lack of public resources, and lack of philanthropic investments. Indeed, as my colleagues Jennifer Lee, Janelle Wong, and I have written, data disaggregation is a civil rights issue for AA and NHPI communities, and it's no surprise that whenever there is talk about data disaggregation or data equity more broadly, our communities pay attention. Next slide, please. As the founder and now co-director of API Data, we have refined our approach over time because we realize that data do not speak for themselves. Interpretation matters, narrative matters. And the approach we take is something that we cooked up at the Center for Social Innovation and is now part of API Data's work. We call it simply DNA, data, narrative, and action. Without systematic data, stakeholders and decision makers do not take communities seriously. But without narrative, our needs and interests are not remembered, they're not memorable, they're not sticky, and so it's important to have both data and narrative together. And ultimately, data is not important just for its own sake, but to inform and inspire action, either action by decision makers and government agencies and philanthropy, but also action by community organizations. Next slide, please. Say a little bit about our team. In addition to Professor Janelle Wong, who's my co-director, I'm honored to be in this work with others like Professors Jennifer Lee, Professor Nines Ponce and Sarah Sadwani, and then Ryan Vin, who just recently joined us as our Data and Community Partnership Specialist. We are expanding our team with a managing director and an API Data Fellow with the National Council of Asian Pacific Americans coming online very soon. Next slide. We'll just say a little bit about some upcoming projects that we're doing, and not only by ourselves, but in collaboration with others. And we would love to have the Commission informed and engaged in these opportunities. Next slide. First, we have a series of monthly strategy calls of our Data Equity Strategy Group. And these include leaders in community-based organizations, government agencies, philanthropy, as well as researchers in academia, as well as other types of research centers. This is a focus on strategy to, again, advance that DNA model on data, narrative, and action. We would love to have you be part of these meetings. Coming up in March, we are doing our one-year anniversary survey, re-upping it with SurveyMonkey, who is now called Momentive, on American experiences with discrimination. This is a survey not only of Asian Americans and NHPIs, but also comparison samples of white, Black, and Latino communities to see how these communities are faring 1 year after the killings in Atlanta. We also are planning a refresh of our state electorate fact sheets with API Vote. In May, we will be publishing a data equity report, which includes planned interviews with leaders in government agencies at the federal level, and we hope to have that data and report to be able to share with you at our National Data Equity Summit that we're doing in collaboration with NCAPA and hopefully federal agencies as well in late May. At this event, we're also hoping to release a State of the APIs report nationally as well as in California. Finally, in July, we plan to release an Asian American voter survey. It's a survey of registered voters with API Vote. So we have a busy 6 months ahead, and we'd love to have your engagement in whatever ways are meaningful to you. Next slide. To say a little bit about our approach to data is not just about thinking about narratives, but to make data as easy to access as possible. Parenthetically, I'll say that while there have been improvements in federal data websites, part of the way that we get attention is that we get people access to the information that they need really quickly. And it's not always easy to get this, for example, on data.census.gov. Next slide. In addition to the community facts tool, which I just featured, we also have a quick stats tool. And these are very simply sortable tables. We have worked with community partners over the years in terms of what are the key indicators they look for when trying to fill out grant applications, right? Or trying to talk to reporters. And so a lot of people have found this tool helpful. Next slide, please. We are beta testing a new tool which will make it even easier for people to select their level of geography, the kind of community that they want to choose, to be able to compare not only across detailed ethnicities, but also to compare it to top-line racial groups. So this is something, as I said, that is in beta testing. If you're interested, you can email ryan@aapi.data.com, and you can be part of our beta testing group. Next slide. Finally, we've also found that pictures, as they say, pictures worth 1,000 words. So it's not just about the data that you put out, but the kind of visuals you put out that make it easy for communities and various stakeholders to understand and grasp an issue. One factoid that I'm so proud that we moved quickly to create, and this was after President Obama had announced the expansion of the DAPA program and deferred action for the parents of Americans, is this factoid of 1 of every 7 Asian immigrants is undocumented. Now, that number has changed since then, but that was a way for people to think beyond just the millions of individuals that might be affected by that issue, and to think just really powerfully about how in any room, if you have Asian immigrants in that room, that 1 out of every 7 people is likely undocumented. Next slide. Finally, we've also worked with groups like APIP. This is Asian Americans and Pacific Islanders in Philanthropy. We did this during Census 2020. We believe that data not only should be accessible, we believe that data can be beautiful. And our community partners used these data points to target, to do more effective targeting when it came to census outreach. Next slide. And you can still see this today, for example, if you go to censusmaps.apidata.com, and we're hoping to get disaggregated data from the Census Bureau as soon as possible. Now, I'll take the next step to talk about some important features of AA and NHPI communities and why it's so important to disaggregate. One, when we think about the changing nature of our community, we have to recognize that our community is changing pretty dramatically with respect to detailed origin. So the South Asian population is growing rapidly, and this notion of East Asian as the default Asian category, it did not apply in 2000, and it is less and less true as the years go on. So it's really important for people to update their mindsets in terms of who Asian Americans and Pacific Islanders are. Next slide. It is also important to look at the vast variation in any particular outcome across communities. So on outcome after outcome, you will detect a pattern where, in fact, you find Southeast Asian refugee populations doing much, much worse than the most prosperous Asian American groups, but often also doing on par or even worse than other communities of color in the United States. Next slide. Now, it's not just about disaggregating the Asian category. It is also important to disaggregate the Native Hawaiian and Pacific Islander category, which, as a reminder, commissioners, is a separate racial group in the census and according to OMB. Next slide. Language proficiency also matters in terms of wide variation within our communities, and you can go to our website to see the various ways in which you see differences across communities. Other key facts you should know about Asian American populations and Pacific Islanders in some future slides. One, Asian Americans are an important part of the immigrant vote. So if you talk about immigrant voters and you don't mention Asian Americans, you're engaging in either scholarly malpractice or journalism malpractice, right? And too often we see stories when reporters talk about the immigrant vote and don't talk at all about Asian American voters. Next slide. It is also important to talk about the rapid growth of our community. And my apologies, I had a slight change in order of the slides from how I saw it. So taking a step back, when you look at the Census Bureau and what the Census Bureau reveals, what it reveals are that Asian Americans and Pacific Islanders are among the fastest growing populations in the United States. This was true from 2000 to 2010. This is also true from 2010 to 2020. Our communities are eagerly waiting data on particular populations to see how those population numbers fare for particular groups. So for example, looking at American Community Survey data, we know that the Bangladeshi population is among the fastest growing immigrant groups in the country, period, and is likely going to be the fastest, if not one of the fastest, detailed origin groups in terms of population growth between 2010 and 2020. Next slide, please. Next slide, please. apologies here. It seems like there was a slight change in the order. Next slide, please. Okay, so in terms of, my apologies, folks, there's been some slight change in the order, but I'll just make do as I can. Thinking about Asian American voters, there is a question about, amidst all this diversity, is there such a thing as an AA and NHPI agenda? This is where detailed data collections are important. Instead of just having a simple yes or no question that is not informed by data, we can look at over a decade of survey research with detailed, disaggregated data collection to identify the conditions under which our communities are in solidarity. And the remarkable thing about our community when you look at public opinion data is that despite all of this diversity, by socioeconomic status, by religion, by income, by language proficiency, you see so much commonality in terms of opinion on a variety of policy issues. I'll save some of this for the Q&A, but these can be broadly grouped under the themes of inclusion, protection, opportunity, as well as education. And on education, it may not be the kinds of issues that people might think. Affirmative action is not a high salience issue from what we see in our public opinion data. And in fact, the community is fairly supportive of affirmative action when it comes to higher education. What they do care about is education access. They care about the quality of public education, and they care about the affordability of education, including college debt. Next slide, please. Next slide, please. Next slide, please. So let's keep going. Another slide. Okay, so finally, I'll talk a bit about Asian American and Pacific Islander experiences with hate crimes. So if you look at API experiences with hate crimes, what we found in 2020, and we're going to be 2021, and we're going to be repeating this in a March 2022 survey report, we found that about a quarter of Asian American and Native Hawaiian Pacific Islanders said that they have ever experienced hate crimes and hate incidents, and that since the pandemic began, about 1 out of every 5. So if you combine the 12, you can't just add those numbers. If you look at those who either experienced it in 2021 or in 2020, 18% said they had experienced it since the onset of the pandemic. Next slide. Next slide. And if you compare this across racial groups, while it is important to acknowledge the relatively high level of hate crimes and hate incidents among Asian Americans and also among Pacific Islanders, it is also important to acknowledge the high level of hate crimes and hate incidents experienced by multiracials in the United States and Black people in the United States as well. Next slide. We also asked about everyday acts of discrimination, and we find that Asian Americans, followed by Pacific Islanders and Latinos, have among the highest rates to those who answer the question, have people asked you where you're from, assuming you're not from the United States? Next slide. At the same time, there are other stereotypes that hurt other communities of color even more so than Asian Americans. So for example, Black people and Pacific Islanders report higher rates of these stereotypes of people acting as if they were afraid of you. Next slide. And in terms of being unfairly stopped and searched by police, we find that Black people and Pacific Islanders have higher rates of incidents than Asian Americans. Next slide. It's also important to look at the data to correct some of the selective inferences we might have based on reports to hotlines or to federal authorities. So while hate crimes and hate incidents among women are important, it is also important to recognize that men in our survey also report high incidents of hate crimes. Native-born people, as well as younger Asian Americans and Pacific Islanders. So this is not just something that affects elderly Asian immigrant women, as some of the social media memes and videos might suggest. Next slide. And there are important implications for policy because these communities are often uncomfortable reporting hate crimes and hate incidents to authorities. Next slide. Finally, I'll just say something about data equity. I'm happy to cover this more in the Q&A, as well as later with you commissioners, as well as with other federal agencies. We've been working with the National Council of Asian Pacific Americans, which is a coalition of dozens of Asian American and NHPI groups throughout the country. And these are some of the recommendations that flow out of those discussions. First, we would like to define data equity as the inclusion and incorporation of community expertise and research expertise, and also to ensure that there is equity in all stages and aspects of data research, including design and development, collection, compilation, and processing, as well as analysis, dissemination, and preservation of data. Next slide. I'll go through the next 3 slides very quickly.
Hey, Karthik, sorry, I'm going to rush you because we've got our 2 next speakers ready to go, and they've got limited time, so sorry.
Yep, no problem. I'll do it in 1 minute. These are the main points we have here, and you can review them at your convenience. Next slide, please. And this is really building on the remarks that Dr. Nelson said. It's really exciting to see the work of the Equitable Data Working Group, and our communities, including our researchers and community leaders, are ready to partner to strengthen the work. So for example, about the disaggregated data repository, there's so much interest in making sure that these repositories are user-friendly and community-friendly. Next slide. The creation of pilot programs, we're really glad to hear about the proof of concept projects that Dr. Nelson mentioned, and it would be great for our communities to be in partnership as much as possible to help expand the scope of those projects with an intentional view to improving the lived experiences of Asian American, Native Hawaiian, and Pacific Islander populations. Finally, in the last slide, in terms of inclusion, not only including our community leaders and scientific experts, but to think about institutionalizing our role similar to the Census Scientific Advisory Committee and the Census National Advisory Committee. I'm honored to serve on the Census NAC along with a few other Asian American and NHPI members, and that would be a great model to follow for the Equitable Data Working Group in terms of recommendations for other federal agencies to follow what the Census Bureau has done. Thank you so much for your time.
Dr. Ramakrishnan, thank you so much. Sorry to our commissioners, we will not be able to take questions because we are about 7 minutes in and want to make sure that we can ensure Dr. Lisa Pino and Kristen Clark have a chance to present. And again, just to keep in mind as we keep moving forward here, Dr. Ramakrishnan offered a lot of information, and there's really great information here. So we should think about what the subcommittee on data disaggregation should think about inviting him both to present, but also potentially to help in the subcommittee as we look through data disaggregation, because he has some great recommendations in there too. So just to keep that in mind as a commission, so no worries. But again, we will have time to invite people and to do more. So please don't see this as the only opportunity. So with that, I'm going to go ahead and move on to our next panel discussion focused on language access, which is another major topic for AA and NHPI communities, and it has been for decades. So in this panel, we're going to learn about how language access works in context of the federal government and what is expected of federal agencies and federally funded entities. I have the pleasure of introducing you to our first panelist. You've already heard from her this morning, Lisa Pino, who is the director of HHS's Office of Civil Rights. Ms. Pino formerly served as the New York State Department of Health's Executive Deputy Commissioner, the agency's second highest executive. And today she's going to share more about what HHS OCR does to address language access issues across HHS. So Ms. Pino, thank you for joining us, and really apologies for our delay, but really great to have you again.
Thank you so much, Sona. No apology needed. It's wonderful to hear that critical information about data. So I'll do my best to keep it concise and stay on time, but hello, everyone. Welcome again. I'm Lisa Pino, Director of the HHS Office of Civil Rights. We are thrilled to be able to focus on the importance of language access for the AA and NHPI community. Next slide, please. So what does the HHS Office for Civil Rights do? Well, we were founded in 1965, and our responsibilities include a range of activities. For one, we investigate civil rights complaints from the public, of course. So for instance, last year, we received more than 48,000 civil rights complaints alone. We also conduct compliance reviews. If we hear from stakeholders across the community of issues of concern, we we go on the ground and we make sure that civil rights protections are in compliance. We also secure voluntary corrective actions on settlements with covered entities and other parties. We provide technical assistance to help resolve civil rights complaints issues as quickly as possible. And we conduct regular public outreach. And of course, we issue policy. So whether it's regulatory or guidance, we do that on a frequent basis. Next slide. From a technical perspective, how do we define limited English proficiency? Well, the Census Bureau officially defines it as those who speak a language other than English at home and who speak English less than very well. Next slide, please. So what is the intersection of the LEP proficiency in the AA and NHPI communities? Well, according to the American Community Survey from over 10 years ago in 2012, 35% of the AA and NHPI population is limited English proficient. That's pretty high. 19% speak English well, 12% speak English not well, 4% do not speak English at all. That's why it's that much more important, our role as the Office of Civil Rights, to work with covered entities to make sure that we're amplifying language access as much as possible. Next slide, please. Why are language barriers so important in terms of the issue of health disparities? Well, the only way that we're going to achieve true quality health care for all underserved communities is by eroding these barriers and making sure that language and language access does not at all interfere with quality health care. We know surveys and research shows that language barriers are associated with lower quality of care, poor clinical outcomes, longer hospital stays, and higher rates of hospital readmissions. That's why it is so important that language access is adhered to by federally funded entities. Next slide. Specifically, what health disparities and discrimination are faced by the AA and NHPI populations? Well, a study released last year by the CDC found significant racial disparities in COVID-19 incidence among this community. For example, the incidence rate of COVID-19 among Native Hawaiian Pacific Islander persons in the sample was more than twice the rate of persons. We also know that media reports since the pandemic ensued indicates how healthcare workers of Asian descent have faced discrimination and harassment. These are only one of two ways that we know that the community is being targeted and not being treated fairly under discrimination and civil rights laws. Next slide. National origin discrimination and language access. Our work is to make sure that everyone is treated equally. People should not be treated differently. Neither should they receive delayed or denied treatment because they are limited English proficient. And the failure of a recipient of HHS funds to provide language assistance services to individuals with LAP may constitute national origin discrimination. And that's where our Office of Civil Rights comes in. Whether it's technical assistance or working with a compliance review, our work is to make sure that this does not occur. Next slide. Our work, as shared before, is to remove those unlawful barriers to HHS conducted and funded programs. Our mission, ultimately, as a law enforcement agency, we do the work of investigating complaints, making sure that compliance is whole, issuing policy. Most of all, we have to protect recipients of HHS federally funded financial assistance from discrimination on any basis, whether of race, color, national origin, disability, age, sex, or religion. Next slide. Our legal authorities for this work of civil rights prohibitions against race, color, national origin discrimination, they lie within Title VI of the Civil Rights Act of 1964, and of course, Section 57 of the Affordable Care Act of the ACA. Both of these laws require recipients of federal financial assistance to take reasonable steps to ensure meaningful access to their programs by persons with LEP proficiency, and OCR has developed guidance to help recipients of HHS funds covered entities comply with this obligation. Next slide. Examples of how we take action. One instance most recently in New York at the start of the pandemic, administrators of a hospital allowed only certified interpreters to assist medical professionals triaging and treating patients with LEP. This made it impossible for hospital staff to keep up with the flow of patients, especially as finding quality healthcare workers was scarce. but OCR worked with a physician who was greatly relieved to learn that interpreters need only be qualified. Therefore, that allowed the hospital to use many more bilingual medical students to resolve the backlog and not be restricted only to certified interpreters. Next slide. You can find on our website on hhs.gov under success stories involving persons with limited English proficiency, a multitude of success stories, whether Colorado, California, Arizona, Mississippi. There you can find how, for instance, in Alameda County Medical Center, we work with the medical center to figure out the best way to amplify language access. For instance, the medical center trained its staff in Title VI compliance and oral written communication needs assessment for LAP patients. It issued medical cards to indicate a patient's primary language. It updated its registration area signage to include the 5 most commonly used language in its service area. The hospital also posted signage indicating that interpreter services are available free of charge, and contacted with video and telephone interpreter services so that immigrants visiting the hospital could get language assistance readily available. Next slide. Civil Rights Division Action Through Collaboration. We have other sister agencies within HHS that we work with on a regular basis, for instance, our Office of Minority Health. We also are fully engaged on our Interdepartmental Health Equity Collaborative, and we readily work on emergency preparedness. So our Office of OCR issues guidance to emergency officials and emergency responders to address needs of at-risk populations, such as individuals with LAP, work that is that much more important under the pandemic. Next slide, please. Being proactive through public education. This demonstrates the many ways that we engage with communities, whether it's providing virtual outreach opportunities, collaborating with federal partners such as the Department of Justice, and conducting interagency and interagency activities, specifically on health equity, for instance. Next slide. Well, we know, especially now, as the AA and NHPI community unfortunately has been targeted, that listening that much more is so critical right now. And in the last couple of years in FY20 and FY21, despite working remotely on COVID, we have participated in more than 30 civil rights outreach events. We know that it is that much more important to work with stakeholder organizations, learn and listen, and adopt solutions for how we can further improve language access and LAP across the country. Some of the organizations we've recently worked with include the Association of Asian Pacific Community Health Organizations, Asian Pacific Islander American Health Forum, Asian Americans Advancing Justice, and the National Asian Pacific Bar Association. Next slide. This indicates different examples of policy guidance that we have issued. So most recently in December, for instance, we issued Title VI Bulletin on federal legal standards prohibiting race, color, and national origin discrimination in COVID-19 vaccination programs. This work is that much more important as we know that the pandemic has only sadly magnified racial and health disparities. Next slide. Other ways that we make an impact is that we conduct Title VI trainings on civil rights for the medical school's training curriculum. So we work with the Association of American Medical Colleges, whose membership includes 172 accredited U.S. and Canadian medical schools. Last year, we trained over 1,000 students on the importance of language access and national origin discrimination. Next slide. We also are heavily involved in implementing Executive Order 13166 to improve access to services for persons with LAP. The goals for each federal agency include improving access to federally funded programs and activities by persons who have LAP, and to implement a system by which persons with LAP can meaningfully access the agency's services. Next slide, which is the last slide. Here's some information of how you can contact us. You can visit our website at hhs.gov/OCR. You can email us anytime at ocrmail@hhs.gov. And please visit our LAP site that has not only success stories, but other tools such as how to have a language access plan for your local covered entity to help us eliminate these language barriers. Back to you, Sonal. Thank you so much.
Lisa, thank you so much. And this was such a great presentation because it sort of gave us a real insight into how an agency, and especially what you at HHS are doing, and how we can see implementation happen. So really appreciate the concrete examples, but also just when a policy happens, how does it actually get implemented? So it was really helpful. Thank you for that. And we hope to continue to engage with you. And I know the initiative is housed there on how we can do more, and what we can learn from what you've done. I want to now welcome Kristen Clark, who is Assistant Attorney General for Civil Rights at the Department of Justice, where she leads the department's broad efforts on federal civil rights enforcement and efforts. And again, yet another agency that is doing a lot of work across government, and so super excited to have her here. Kristen, welcome. We can't hear you.
Sorry about that. Thanks so much. It is wonderful to be with all of you today, and I'm pleased to follow up on Dr. Pino's presentation. It's great to be here to talk about language access, which is a top priority for us in the Civil Rights Division at the U.S. Department of Justice, and we know a top issue for so many in the AA and NHPI community. Dismantling language barriers and communicating accurately with the public has a direct impact on the success of your work, our work, and all of our efforts to combat anti-Asian bias and our work to combat hate and to promote equity. At the Justice Department, we know that when public entities communicate only in English, that they are missing out on opportunities to receive complaints and tips. They're missing out on chances to hear from victims. And most importantly, they are locking out 25.6 million limited English proficient individuals living across the United States. We know that for LEP people, language access means access to the ballot and to schools, state courts, healthcare, public transportation, and many other critically important activities. And without access tools like oral interpretation, written translation, and direct, competent in-language communication, LEP individuals and communities may not know about federal efforts addressing things like bias and hate. They may not know about our efforts to promote environmental justice or to advance equity and more. We also know that we won't be able to effectively serve stakeholders, partners, and advocates. And so at the Civil Rights Division, we remain committed to ensuring that language barriers do not prevent LEP individuals and communities from fully participating in public life. And I want to highlight some of the ways we do this for you today. Over 2 decades ago, in August of 2000, President Bill Clinton signed Executive Order 13166, the goal of which is, quote, to improve access to federally conducted and federally assisted programs and activities for persons who, as a result of national origin, are limited in their English proficiency. President Clinton gave the Justice Department the central role in meeting this goal and assigned the Justice Department the task of issuing guidance about the requirements of Title VI of the Civil Rights Act of 1964. And this critical law prohibits discrimination on the basis of race, color, or national origin. And a failure to provide language access to LEP communities can be a form of national origin discrimination. So this means that the Justice Department is responsible for working with federal agencies to ensure that the federal government all around is equipped to do business in critical languages. And we're also working to make sure that recipients of federal funds know about their obligations under Title VI. Since the executive order was signed, many federal agencies have developed language access programs and plans, and these efforts have proven really critical. Through Hurricane Katrina, wildfires, the September 11th attacks, the current pandemic, and more, we have worked alongside our sister federal agencies and with state and local partners to review, prepare, and issue language access plans and policies to make sure that essential life-changing information is available to all members of the public, regardless of the language they speak. In fact, just last month, a federal interagency committee chaired by the Civil Rights Division issued a guide on improving access to websites and digital services for LEP people. The Civil Rights Division has also created tools that help the federal government communicate and maintain a multilingual online presence. So, for example, we maintain a federal language access clearinghouse where users can view federal agency language access plans and Title VI LEP guidance. You can also download a copy of I Speak language identification cards and get tip sheets on working with telephone interpreters. All of this information and more is available at www.lep.gov. The website also includes our language map app, which allows anyone, a mayor, a governor, an advocate, a school superintendent, a librarian, or hospital administrator to determine within seconds if there are LEP people in their county or state, and most importantly, the languages they speak. Some examples of AAPI languages found in the MAP app include, but are not limited to, Hindi, Japanese, Korean, Laotian, Thai, Urdu, and many more. And this type of AAPI language data, we know, helps afford government the information that they need to identify and dismantle language barriers. I want to be clear that this work doesn't just apply to other agencies. It applies to us at the Justice Department. And so we've made it a top priority to ensure that LEP people have access to the services that we provide. In fact, in May of last year, Attorney General Garland committed the department to establishing a full-time permanent language access coordinator to increase the department's ability to serve LEP people. I know that yesterday you heard from my colleague, Deputy Associate Attorney General Rachel Rossi, who talked about our work to combat hate crimes and providing resources and services in all languages is a critical step towards building community partnerships and trust, increasing the reporting of hate crimes and hate incidents, and ensuring that our resources are community-centered. So, for example, we have translated our hate crimes website to make it easier for LEP people to get help or to report a hate crime in a language other than English. Right now, you can report hate crimes in 14 languages, including 8 Asian languages, and we're in the process of obtaining more translations right now. The Civil Rights Division is better prepared now more than ever to field all kinds of civil rights complaints in non-English languages. We're able to take non-English language complaints by phone, mail, email, and in person. And in May of last year, we updated our civil rights reporting portal located at civilrights.justice.gov. It is now available in 5 languages spoken by LEP people, including Spanish, Chinese, both simplified and traditional, Vietnamese, Korean, and Tagalog. We've also prioritized training our staff to respond to and investigate allegations made by LEP victims or witnesses. And since 2013, we have trained new attorneys and staff on how to communicate effectively with LEP people, and we've shared our language access training curricula with federal, state, and local agencies. Beyond our work with agencies, we are also working to ensure that schools, polling locations, police departments, jails and prisons, juvenile justice programs, court systems, and other state and local agencies that receive federal funding are also living up to their obligations. When a state or local agency or organization receives money from the federal government, receives a grant from the federal government, that entity is committing to complying with Title VI and committing to using that money in a way that does not discriminate on the basis of race, color, or national origin. And at the Justice Department, we're leading our enforcement of the language access provisions in Title VI to ensure that these agencies are meeting the needs of LEP people across the country. One example of the language access enforcement work that we do involves state courts. And last October, we entered a resolution with the South Dakota Unified Judicial System that will improve access to state courts for LEP people. Our efforts helped to spark a change in state law, which is great. Last June, we signed a settlement with Fort Bend County, Texas, to improve access to a court for LEP people and to ensure that they're providing interpreter services at no cost to LEP people in all civil and criminal cases in the county. This agreement includes providing notice of the court's language access plan in Vietnamese, Chinese, Urdu, Tagalog, Gujarati, Hindi, Arabic, and more. And last March, we entered an agreement with the Colorado Office of the Administrative Courts to help LEP people access timely and competent language assistance during administrative hearings. We've also worked cooperatively with Vermont and Hawaii courts to make it easier for LEP people to vindicate their rights. Our resolutions in these and many other state court matters mean that millions of LEP people, including those from the Asian American, Native, Hawaiian, and Pacific Islander communities, have gained meaningful access to the state judicial systems. I want to note that our language access work extends beyond institutions that receive federal funding. We have experts in the field that are also working with non-federally funded agencies to ensure that they're able to overcome language barriers. Another key aspect of our work involves access to the ballot, and we at the Justice Department monitor elections to ensure that all voters have equal access to the electoral process under the Voting Rights Act. The Civil Rights Division vigorously enforces the minority language provisions of the Voting Rights Act. This federal law requires that certain communities across the country provide bilingual written voting materials and voting assistance for covered minority languages based on a list that's produced by the U.S. Census Bureau. And the latest list that just came out a few weeks ago identified more than 330 jurisdictions in 30 states that are required under federal law to provide language services to voters from many language communities, including Asian languages. We monitor elections, and where appropriate, we work with jurisdictions to ensure that language minority groups can participate effectively in our democracy. Access to schools, another important area. And here we're working to make sure that students can attend schools free from discrimination and that schools provide language services for LEP parents. We've negotiated with school districts to ensure that students have the language services and support that they are entitled to under the Equal Educational Opportunities Act of 1974. Over the last year, we've reached settlements with school districts in Arizona, Maine, New Hampshire, New Jersey, North Carolina, and South Carolina, and these agreements require schools to communicate with LEP parents in a language that they understand, empowering all parents to participate in their children's education. We also know that many students, especially those who are English learners, suffered disproportionate setbacks during the pandemic. And in May of last year, along with the Department of Education, we released new resources in 12 languages for students and families that confronted COVID-19 related harassment. In August, again, with the Department of Education, we issued a resource in 3 Asian languages that address discrimination based on national origin and immigration status. And both of these resources provide clear advice for families and provide examples of what we can investigate and instructions on when and how to file a complaint. Last but not least, I want to just briefly discuss the division's pandemic-related work because it highlights the critical role that we play in working with our sister agencies when it comes to language access. We know that early on during the pandemic that we were likely to see significant civil rights implications. Our experience responding to H1N1 and Ebola had already alerted us to the need to protect individuals of races or or ethnicities who are unfairly targeted because of their perceived link to a disease. And over the last 2 years, the Civil Rights Division convened meetings of more than a dozen federal agencies to share information about civil rights concerns arising from the pandemic. We monitored harassment and discrimination against Asian Americans and Pacific Islanders and sought to better understand and address the devastating health outcomes for vulnerable communities, particularly Black, Indigenous, and Latino people. As a result of these meetings, the division issued a statement about the need to protect the rights, the civil rights of vulnerable people, including LEP communities during the pandemic response and recovery. This was translated into 5 AAPI languages and reminded federal, state, and local agencies across our country of their obligations to combat hate crimes, harassment, and discrimination, their obligation to ensure equal access for people with disabilities, their obligation to reduce learning loss for vulnerable students, their obligation to protect correctional staff and incarcerated people and people held in detention, their obligation to protect vulnerable people facing housing instability, their obligation to provide critical public health information in languages other than English, and their obligation to collect data to monitor, track, and ensure equitable outcomes. As I wrap up, I just want to observe that while much progress has been made in the field of language access, we know that there's much work that remains to be done. And nonprofit and community-based organizations continue to be unfairly burdened with the responsibility of having to serve as interpreters and having to translate materials. And we know that some federal agencies have not yet posted or updated their language access plan. So clearly more must be done. And we're going to do our part at the Justice Department. And, I just want to emphasize that we can't overcome these barriers alone. Each of us, federal staff, commissioners, community organizations, private companies, members of the public, we all have a role to play to ensure that the voices of LEP people across our nation are heard. And we encourage you to reach out to us and to federal agencies to tell us how we can do better at serving LEP communities. Are there websites or flyers that would be of particular use to your community if translated? Are there radio stations or newspapers that would be interested in translated press releases? And are there entities receiving federal funds that are not stepping up to their obligations under law? We want to hear from you, and we want to work together with you to find solutions and look forward to working with all of you to overcome language barriers across our nation. Thank you so much for having me here today.
Assistant Attorney General Clark, it's so great to have you here, and thank you for such detail on the work that you all are doing. Commissioners, we're going to open up for questions. I'm going to use my one prerogative to actually open with the first question, but just a note on the presentation by Kristen Clark. I think it's important to recognize the vastness of the federal government and all of the things that are happening. Because sometimes it's easy to say it's just A or B, but when you think about the vastness of the government and the number of places where you think about language access and how to think about language access. So really appreciate that you walked through the many ways that DOJ is approaching this, and thank you for such a detailed presentation. I know our commissioners have a lot of questions because I've seen them pop up in the chat function. So I think we have you for about 10 minutes for questions. So I hope you can stay on with us. Lisa, I'm going to start with you first, and just a quick question on, you talked about meaningful access to federal programs. Can you give us a little sense of what that means and elaborate a little bit on how departments like HHS take to ensure meaningful access for AA and NHPI communities?
Absolutely. Thank you, Sonal. Well, as you shared, the work across the federal diaspora is vast. So I'm going to answer that question looking at the different layers that comprise that work, right? So for instance, from a more technical local level, like, does your covered entity, does the hospital, the healthcare system near you and your community, do they have a language access plan on file? Do they have one, that's reflective of current times and the current diversity? That's one of the ways of making sure that meaning actually is implemented and exists on the ground, right, with the people that they have impact. And then from a broader level, from the federal level, it's looking at, how we can further exhaust legal authorities we have under Title VI, but create that meaning in new ways, in the sense that it is more inclusive and equitable. So for the Biden-Harris administration, racial justice, is one of the principal tenets, and of course, working across bridging health divide that the pandemic has only exacerbated, that is another central tenet. So, our responsibility here in the federal service, especially as part of reflecting the values of this administration, is to make sure that whatever policy or guidance or direction we're providing here in Washington, that's actually abided by and is respectful and inclusive for communities on the ground. So with LEP, we do have the ability to address civil rights complaints. We do have the ability to conduct compliance reviews. But just starting with the basics of what is the language access plan that makes a difference in preserving quality health care? What can, the commissioners and local leaders do to make sure that that entity either, takes that language access plan from the 20th century to the 21st, or whether if it's a good plan, how do you hold them accountable? So I think we all play a role in this important work, but never has, the importance of LEP in healthcare, especially since COVID, for this administration right here, right now, played such a critical role to making sure that, lives are being saved, people are getting the treatment that they deserve, and just the respect and dignity, that honors the diversity of who we are as Americans.
Thank you. Can we go into gallery view? Because I want to make sure we can see all the commissioners here. Kristen, I'm just going to ask one quick question that was in the chat, and I think you may, what's the difference between language access and discrimination? Sorry, you're on mute.
My apologies.
No, this is COVID life in general.
Exactly. Can you repeat the question? So sorry about that.
We had a question here on the difference between language discrimination and language access, and what about workplaces that require people to use only English?
Yeah. So I think language access is very affirmative, right? That is, being really attuned to and intentional about, ensuring that all of the services that you provide are accessible to people regardless of language ability. I think this work is especially important in the law enforcement context when we're talking about, people who may be entangled in the justice system, people seeking to exercise important rights, right? So language access is just working affirmatively to make sure that you are not leaving anyone out or behind. Language discrimination, to me, refers to kind of the need for enforcement work and addressing the ways in which entities may be running afoul of the law, whether that is the Voting Rights Act or Title VI of the Civil Rights Act. And language discrimination we deem to be discrimination on the basis of national origin. We encourage and promote language access, and we look to fight and address language discrimination when we see it, and when we see it carried out by entities that are violating the law.
Thank you. Ajay, you have a question?
Sonal, thank you, Christine. Thank you, Lisa. That was very insightful and very meaningful presentation. Christine, my question is to you. When your department is doing a lot of great work in terms of promoting language access, one question: has the department thought about converting the Department of Justice website landing page into multiple languages, plus all the key announcements, notification, rule changes, etc., going out in multiple languages and engaging the API media.
So I think I understood the question to be whether all aspects of the Justice Department's website is made available in other languages. Is that correct?
Yes, because if you take any major private corporation website, on the right-hand side there is a language button, and you can click and convert the landing page into any language.
Well, I feel like this is an ongoing project for so many federal agencies. We have worked to ensure that critically important parts of our site, the complaint portal where the public can bring forth complaints, the site dealing with hate crimes, which we know is such an incredibly important issue now, particularly on the heels of new FBI data that shows a 70% increase in hate crimes faced by the AAPI community. We've worked to ensure that critical information and critical data about services we provide are made available in other languages. And we need to continue that work and continue that push. And we want to hear from you and encourage you to be in touch with us by way of our lep.gov website. I know that I have a colleague here who shared the link in the chat, but we want to hear from you to make sure that we're directing our enforcement resources to the proper places. So a federally funded hospital, for example, or federally funded police department in your community that's not living up to their obligations, we want to know about that so we can direct our enforcement efforts to the right places.
Grace?
Yeah, I had put this in the chat earlier, and it could be to either Kristen or Lisa, but it has to do with the fact that, some of our communities, we have small pockets spread all over the country of people that speak different languages. And, under the legal analysis, we've been told over and over again that federally funded entities have like a safe harbor in terms of what they're obligated to do in terms of providing language access. And, it is the folks that have, the least access because of the fact that they're small pockets, right, that to critical services. And so I'm just curious what efforts, there might be or what we can build upon in terms of, pooling resources or strengthening positive encouragement or whatever it might be, or thinking about the analysis differently for those pockets of folks that, really are struggling because, they're not commonly spoken languages.
Dr. Pino, not sure if you wanted to speak to that.
Yeah, no, I'm happy to weigh in. Thank you so much. Commissioner Wang, thank you for that important question. I think as I shared, more than ever, listening and outreach is so important for us to know what's happening today, right now. And we have different vehicles. So we have an LEP interagency committee that collects some information. But I think that, for us and even welcoming to partner with DOJ, holding listening sessions, being able, in all of you as your role as commissioners, being able to funnel, specifically what communities, what the technical barriers are, it can be as simple as, are there enough language access plans that sufficiently address all the diverse communities? So for instance, in my presentation, I touted how, a hospital in New York wasn't doing enough, right? And that it was just like a simple, this is what we would deem like a technical assistance, like an easy solution. Like the hospital had one understanding of what, their responsibility was for translation services. And in reality, it was a much lower bar, right? So they didn't realize they meant well, but they didn't realize how much flexibility they had, right? And that's something that we can do because we want to be able to address those systemic inequities as easily, like nip it in the bud, from the onset. It doesn't have to become litigious. It's not something that should be, years in existence, right? And I think that's why, for both myself, our office, and Assistant Attorney General Clark, like knowing that we're here, knowing that we're ready to be responsive to all of you, your new role as commissioners, working together. I don't see it as just one way. We have like ample vehicles that kind of like, it's like a cross section, and the more that we can find a way where that community or you can relay what's happening in that specific pocket of the community, and the faster we can address it, the more readily we can bring that relief and build that reassurance back that, the federal government really is here to address these problems and that we care, right? It's not something that should take years in the making, but I will also look into how we at OCR and HHS can do more outreach this year and make it easier for people to share what they're seeing, because not everyone is comfortable with writing a civil rights complaint. It sounds very burdensome, but we can make it easier for communities to figure out how we can make things better in terms of LEP.
Well, Assistant Attorney General Kristen Clark and Director Lisa Pino, we are so grateful that you took the time to both give us so much detail about your agencies and what you are doing and how this works across the government, but also we look forward to continuing to engage with you as we get started on our work. So thank you for taking so much time, and thank you for your great presentations and for taking questions. Really appreciate it, and look forward to working with you in the future.
Thank you for having me.
Thank you all.
And commissioners, we have a 10-minute break. We will be back at 3:20 Eastern time. If you all can make sure we're back, because we'll have about an hour to follow through. So please take some time, and I'll see you in about 10 minutes.
It's 2:20 now.
Welcome back, commissioners. Welcome back, public. That was a great morning. I mean, there was so much information there. I think my head is still reeling from all the information that we got today. But it was a good way to really think about how to systemically approach some of the challenges, especially in data disaggregation and language access. So hope it was as useful to you as it was to me. But I think now the next hour and a half, we have just a lot of work to go through in terms of thinking about how we want to move forward for ourselves. So reflecting on yesterday's presentations regarding the immediate challenges and today's on the data disaggregation and language access for impacting AA and NHPI communities, especially related to Executive Order 14031 and our priorities 1, 5, and 6. So as we start thinking about developing our recommendations, time is important for us because there are things, as you heard already from yesterday and today, that the president's work on equity, they're already moving forward on recommendations. There's opportunities here for us to get engaged early on. So I recommend that as a commission, we develop recommendations and submit our recommendations on a rolling basis. As a president towards mini reports, so rather than have one big report at the end of the year, that we do sort of mini reports and things that we see are moving that we can actually engage in. But I wanted to make sure we get your feedback and let's have a little discussion about it because I think it's important that we're all on the same page on that. So any questions anybody might have about rolling recommendations?
I think I agree with you, Sonal, because we have such limited time and you want to get as many out as soon as possible so that the administration can have time to work on it.
Great. Thank you, Kimberly.
So
anybody, oh, sorry, go ahead, Jen.
I was just going to ask, were you thinking rolling kind of across issues? So wherever within all of our priorities, wherever there's an idea that we can move to just Correct. Go ahead. And I think that's great.
Yes.
I support that.
Great. Thank you for clarifying that. I generally appreciate that. Yes, rolling across issues, no one issue, not only X or only Y, but we should be able to do it across issues. Dr. Underwood.
Yeah, I just wanted to, the community is so diverse. And so is there going to be, just listening to the data disaggregation and the terms that are used and everything, so are we free to kind of let other commissioners know about the diversity of these communities? Because I think that all of us could come up to speed on the diversity of some of the communities, even as we're going through these recommendations, because these recommendations are going to mean a little bit differently as applied to different communities.
Yeah, and Dr. Underwood, that's a great question, and I may not answer it completely. So let's that's we should keep that in mind for all of our recommendations because we are in diverse communities, and some things, and maybe the way to approach it is to recognize that this may affect some communities, not affect all communities, but let's just be upfront and intentional about it because I think it's important to state our intentionality and to make sure that we recognize when we do see that. So I think that's a really good point. So thank you for.
Yeah, but are we free to communicate with other commissioners? Correct. To tell them, hey, look, this is what's going on in this community, or you may want to see this nuance.
Absolutely, and I hope you do. The commission should be talking to each other. Do not feel like we can't reach out to each other. We are a community, so please definitely feel free to do that.
Okay, thank you.
Any other questions? All right, so we're going back to our famous Miro board, and I think what I'd like to do is we started yesterday and on items which commissioners would like additional information to inform recommendations. You see that that's in blue on your left-hand corner there. The light blue on the left-hand corner or light green. I don't even know what the color is, but there's a lot there, and we had a lot of requests for more information. You may have some more from today, so if you want to, if we we want to, we can go through some of those and see if there's more questions that you all have in terms of, and can we see a little bit more detail on that mirror board? Can we go deeper into those on the top left? Oh, I don't think we can make it that. So why don't we do this? We'll start capturing the information. We can certainly send out the information to everyone. But based on today's presentation, are there specific things that we can, that you want more information on for today's presentation? Ajay?
Yeah, I would like one question, either for Karthik or the other presenter. What are the different ways federal agencies are collecting the data for AA, NHPI? And I mean, which agencies are collecting the data, what forms they are using it, and as part of their program right now, what are the other ways of data collection are being explored for implementation across the agencies?
Yeah, great question, Ajay. Grace?
Yeah, just similar question to Ajay, just building on that, specifically whether data collection is being done in accessible ways, because we just know lots of folks aren't being surveyed or asked information in their own language. So,
yeah, great question. Dr. Underwood?
I want to kind of clarify the intersectionality of this data. So are they veterans and certain groups, rural areas and certain groups? I'm trying to figure out because if the administration has certain objectives for rural areas and certain objectives for racial and ethnic minorities, and how does the intersectionality of that, and are they collecting that, or do we have to find that ourselves some other way?
Yeah, that's a great question, and it's good to ask. Daniel Day Kim.
Hi, I would just love to get access to that database to kind of play around with it. I think he mentioned that it was in a beta a test situation. Yeah. But as soon as it's available, it'd be really great to be able to use it to get information. And the entire presentation from AAPI data, if there's any way to get that slideshow, it'd be great for talking points.
Yeah, we will send that around. We will definitely send around the presentations that you all have seen. So I think the one other way, and thank you for asking that question, one other way for us to think about this also for the data disaggregation subcommittee, you may want to think about inviting Karthik into the subcommittee and either having him participate in the subcommittee or present to the subcommittee, because I think there was a lot in that presentation which she had to quickly skip through, and I think there's a way we can certainly benefit from him. Kaying?
Yeah, I guess what I need to see more, and maybe it's just me and my fear that I may not have all the information, is the equity plans that she was talking about, the data disaggregation plan that the federal government is talking about, because we don't have to start from scratch, but we could elevate priorities or help them prioritize what their recommendations are to all federal agencies, right? And so that's one thing. The other is just building on what Dr. Underwood said. I think that geographically too, I think is an issue, because in the Midwest, the makeup of our Asian Americans are very different. How do we, talk about that, not just the national level? And then finally, I think my concern is, at what point can we bring in communities who are doing a lot of work on the ground already? I understand that we can open it up, but I will also really think strategically about where, who, and at the grassroots level is already doing this work, and how can we include them either in reviewing the plan or recommendations or contributing to the recommendations.
Okay, that's a great set of points that you made. My guess, and this is just, I can't speak for the government in any way here. My guess is the equity plans that get submitted still have to be reviewed. And so I think what we can do is we can ask them to come speak to you in one of the subcommittees and give you insight and input into what did the plans say, and might give us a chance to also help inform some of the plans as they're reviewing them. So I would suggest that we should invite them to come speak to us. And as opposed to community input, I think that's great. And I think subcommittees may want to think about doing regional forums to invite community members in to give input and to make sure that we're taking the input as we're developing the recommendations. So I would recommend the subcommittees think about bringing that in, but it's a great question. Reynal?
Yeah, so the data disaggregation topic, is it new? There's a lot of us have been doing it for about 20 years looking at it. I think what I'm worried about is the Herculean task. You're talking about all the agencies and all of them have different ways of collecting the data and it hasn't been standardized. My worry is that we spend a lot of time in trying to educate us on doing that part. And we don't have enough time to prioritize what we really need to go after. Is there a way, and I would assume what we're talking about is usable data for local groups. How do we integrate the IWG and the region?
Interagency working group. Yep.
Interagency working groups, as well as our regional teams, to figure out, because people are doing it. I think the common answer that we got before was your groups are too small to sample. But AAPI data and a lot of other investigators have shown we can do it. You just don't have the resources and the infrastructure to do it right now. But people are showing you models how to do it. So how do we go after those? How do we bring those models to the table?
Yep. So I think that's a great question. And you're right? This is on the data disaggregation work for us to recognize that this work has been going on for a long time. I know the Obama administration very much focused on this. And so this is a build. So I think what you heard today from Dr. Nelson and the team is really about they're building upon the work that had already been done. If you remember, chief data officers were created in the Obama administration. Now we have an equity working group. So there's a lot that's happening in this. I think what we can do is inform how the next steps will be done. And that would be very helpful to do that. So I 100% agree with you that we should build where we need to build to, as opposed to needing to redo an assessment, because I think the assessments are already, people have them. So I think what we really need to think about, and what I would urge the group to think about, the subcommittee, is how do we want to move it forward? And this is why the rolling submissions will help a lot, which is really informing what the next steps that they do on the in the in the IWG, but also as recommendations are put out through some of the working groups. So thank you for that. Jen?
I was interested in the overlay between some of the labor market data that we heard about yesterday and the AAPI data work today, just thinking a little bit more about trying to understand where communities are concentrated in low-wage sectors, and if there's a way to also understand access to benefits and access to a safety net, and where that may be, what we might learn through disaggregated data about our communities. If that exists anywhere, I'd be interested in that. And then I'm also interested in how we or others, the government, or even people in the field, are using some of this data to do forecasting in our communities, just trying to understand what are some of the emerging trends, where are we going to see a lot of growth in our communities, et cetera. Who's doing that, and if it's happening in our government at all.
Jen, that's a great question, and I think that is something that, if the team can help us identify where we might be able to get some of those answers, that's a great question. I also think that as the working group might want to, the subcommittee may want to think about inviting in maybe somebody from the Urban Institute, because I know they've done forecasting before, to give us some input on what they have seen in other agencies or where they have seen this work. It might be very helpful too.
It's a great idea.
Louisa? Happy birthday again.
Thank you. So I think most of the questions that I had have been answered, but I am interested in this accountability thing. It's great that our federal government under Biden is doing all of this stuff, but we have to get down to the local level. And, you know, how do we make sure the state and the counties are actually gathering the data that we need so that we can pinpoint, you know, issues that we can address? And then the other question I had, or comment I had, is I think as commissioners, we have the big stick, right? And we have to do our job in terms of helping the federal agencies to hold local governments accountable, and then also just hooking up with the community groups. So there's that. I'm hoping we can do that. I don't know if there's a process that we have to go through to get, you know, the right people from local government into a meeting with us. And then the other thing, is it possible to get a list of community groups outside of the ones that were named, like NCAPA? Those are big community groups, but are there community groups by region that they've met with?
Yeah, Louisa, I think those are great points. Let me start with your second question, and then let's. My guess is when we meet with the regional networks, they can help us because they're already interacting with community groups, not just the national ones, but at the regional level. So we should ask the regional networks this question because they're very connected into community, and I think that would be a benefit to us to ask that question of them, not just at the federal level, but at the regional level. So that's a great question. Regarding the state, local versus national, I think this is going to be sort of an interesting question as to where does the federal government have jurisdiction to require, and where is it a state government's responsibility to do? And that is going to be, I think, one of the set of questions that we will have to ask along the way, which is what can the federal government do, and what is how can they interact with the state to encourage? I'm not always sure. At least my experience in the past has been the federal government can't mandate certain things, but they can require or ask, and that's sort of how we set the standards to do that. But that's a set of questions we should ask, and it's a great set of questions for us to be asking, which is how can we align federal, state, local? So I think that's something we should always keep in mind through all of our subcommittees. But I think we'll come up against some of those questions.
Thanks.
Kamal?
Hi, guys. Really love today's data presentations, especially the DNA framework that Karthik laid forth. I think it organizes thoughts in a very nice way towards action. But I would really love to see some resources dedicated to putting together again a list of resources for the community, for nonprofits, for local level community organizations that could access data, because look, we have a very limited time on this commission, and I think the longer term vision of this is to have communities help themselves. Obviously the federal government's going to help, but if we could empower local communities and local organizations to and do that by giving them access to data, maybe form some binder, something where that they could reference, I think it would be very, very helpful.
I guess, Kamal, you're saying some kind of data warehouse where community can access the data, create reports out of it, and run.
Well, not just the data itself, but like there's, just from today's presentations, there's over a dozen different areas where data is being dozen different areas where data is being collected from, right? Like different again, resources that are online and offline. So it would be nice to put that all together and offer it to the communities and say, hey guys, this is stuff that is available to you. Reach out to these folks and go forth, do great things.
Yep, that's a great point. I think there's a lot of data online. I think that's a good place to point people to where is it and where can people go find it. That's a great point. Thank you for that and really appreciate. Carrie, you're on mute.
Thank you. I'm sorry. I'm a little uncoordinated here. Information overload from today and yesterday. And let me just say that it is so compelling. Like I said, it's important and really is a call to action for this commission. Thank you for all of the people that participated in putting this two-day meeting together. And I don't want to sound like a broken record. Gathering data is definitely important, but as I mentioned yesterday, the time is now. We need to act on some things right now. People's lives are in jeopardy. General Westmoreland once said that Asians don't value life the way, quote, we do, unquote. Do people have to die in Hawaii before something gets addressed? Right? Gathering data is good. We don't even know if a phase 1 environmental impact report has been done. We don't even know if any kind of geological survey has been done. We have no idea if HHS has done any kind of public health survey, right? And what kinds of multi-agency, multi-pronged approach is being taken to address this issue right now? And so I'm confused about the next steps moving forward. Is there something that we can do right now? Can we ask EPA and all these different agencies to present their reports on what is being done, if anything at all?
So, Carrie, I think that I appreciate you're consistently pushing us on this. And so thank you for continuing to push us. And I do think that you are right. So I think as we go through the next steps of developing our subcommittees, I think that is a job of one of the subcommittees to do, which is to reach out to the agencies and ask these questions. And I think as part of our rolling recommendations, this is certainly, we can also recommend what are the next steps after you get these briefings. So I think there's just even sometimes asking the questions moves the conversation. So just to give everybody an update, a thought on this, which is, by asking everyone to present the last couple of days, it's focused the agencies on what are they doing on AA NHPI issues. So again, even asking the question is important. So please keep that in mind, that this is important. So when you do ask, it also forces the next round of conversation. So please keep that in mind. So Carrie, we hear you, and I think this is going to be important as we set up the subcommittees to think about what's the first step of one of the subcommittees to do. And let's think about what subcommittee that is and how to get started on that. So thank you for continuing to push us. Mia, sorry.
Hey, thanks. I 100% agree with Carrie. I think it's good for us to know what our short and long-term goals are going to be when setting up a subcommittee. I think each subcommittee will need to figure out sort of what those goals will entail so that we have a plan going forward and put up front the most sort of emergent issues up first, and then go down the line of list of issues. One of the things that I wanted to bring up, which is often not talked about in in our communities is the amount of transracial and transnational adoptees that are within our communities and are often sort of left out of the conversations around our issues. And I would love to see not only in things like data disaggregation, but also in health, et cetera, to include some sort of disaggregation around adoptees, particularly because it's such an issue that isn't often addressed, and also thinking about the issues around trafficking and migration issues also affect transracial adoptees. And many of the transracial, transnational adoptees are from Asian countries. So I think it's really important that we also bring to light issues around adoption that is also like harming our countries of origin or our ancestry, in the fact that it's moving kids away from their cultural ancestry. So just wanted to bring that up as sort of a topic for folks to think about as they are doing subcommittees, is that this population is highly invisible. They're often seen as children, although most of them are actually adults because adoption is actually waning. So really hope that folks keep that in mind as well.
Mia, thank you. And keep reminding us, and also feel free to reach out to commissioners on various subcommittees to ask that question too. I think that's a great point. Nahi?
Hi, I just want to second Mia, like that was great. Really quickly would like to just suggest we get some more information about how parts of our community are being attacked based on multiple identities. So I was thinking in particular religion, and thinking of what's happened to the Sikh community, the Muslim community. And it would be great to hear more about, for example, like it was wonderful to hear from Kristen what the Civil Rights Division's doing to address those issues, what DOJ is doing generally. The White House has done a lot of outreach on these issues, and it would just be great to hear more about it.
Yeah, that is a very good point. And I think as we do the anti-hate subcommittee, I think that's important. And we'll talk about it in a minute, but please keep that in mind and please keep raising this because it's important that we do get that. So that would be very good information for us to have. Thank you. Amy.
Thank you. I couldn't figure out my raise the hand function, didn't work. Two things. I do agree with Carrie and others who have mentioned the Red Hill water situation. I know that our congressional delegation is on top of it, and locally we're having hearings and it's really the Department of Defense and the Navy that are the problem here. But maybe at some point offline, you can figure out what's the easiest way to just communicate our concern to the agencies that are involved, because our congressional people and Hawaii are actively addressing the issue, and it is in the headlines, and we have efforts underway. The second thing I wanted to comment on is that collecting data and disaggregating data is really helpful. And oftentimes I would recommend that some of the language access issues and data collection, there's a lot of overlap there. We're trying to get some of our agencies to collect data on primary language use. So it's not just the collection of data, it's what kind of data are they collecting. And I think our language access committee could weigh in on that and cooperate with the data collection disaggregation group. And I think the other point I wanted to, while I have the microphone here, is really the issue of less commonly spoken languages. It is really very, very difficult for these communities, and so that would be, I think, an area for special focus and attention of the Language Access Committee. And one other item I'd like to make sure gets added somewhere is the COFA community. That's the Compact of Freely Associated States. It's an international agreement with 3 countries, and they are allowed to migrate to the United States, but they don't have hardly any benefits and are highly discriminated. And right now in Hawaii, it's the most vulnerable community. And so somewhere I'd like to make sure that we include that item in some statement. So that's about it. One more thing. In Hawaii, we did pass the state language access law in 2006. It's probably one of the best in the nation, but we barely implemented. We just, keep on attacking everyone, saying, duh, that's the law. And same with its Title VI, but the implementation is a real problem in terms of language access. So I'll be joining the Language Access Committee.
Awesome. Thank you. And Amy, thank you for these great comments. And I think this is, and thank you for reminding us of the state legislators already involved in Red Hill. So appreciate that. And as for, I think COFA and the other pieces that you raise, I think again, within subcommittees, these are the discussions we should be having and what are the recommendations we want to make and how do we want to do that? That's something that I certainly hope that the subcommittee will take that on. Thank you for agreeing to be on the language access subcommittee. If I heard you correctly.
Yes, thank you,
Teresita.
Hi. So my question is on a slightly different track about what we can do as a commission, as a committee, and as individual commissioners. We have a huge array of issues before us, some that are regional, some even more localized, and some really broad spectrum. I remember one of the comments of the former commissioners, I think it was Dun Nguyen, who, because of his passion for data aggregation, he went ahead and pursued using, his role as commissioner to be able to push for changes. So I would like to understand better what our latitude is in being able to act as commissioners, even if it's under the broad umbrella of issues that we're going to take on as a commission, but then more highly specialized for a specific stakeholder group or region.
Teresita, I think that's a great question. I'm going to ask Emmeline to also weigh in here because she knows more about the details of to do this. But I think my one bit of recommendation would be to say, let's take the issues we want to work on. What are issues that already are moving in process where we may be able to weigh in and help move along faster? And then what else do we want to do? So again, these are rolling recommendations. We don't have to do everything at once. We don't have to get all of it down at once. I think we have to get pieces moving along. So that's, I don't have a grand answer as to what the right thing is, but I do say, I think this is our role as a commission to work that out and to think about what is it we want to do. I don't think we're not limited. We're limited by the scope of the executive order, but what we're not limited for is how we choose to move forward. But that requires us subcommittees coming together on agreements. Does that help?
Yeah, that's absolutely right, Sonal. So you'll want to focus on what your charge is within the executive order. However, how you approach that can be done through the subcommittees. And if you need additional information to inform those decisions, if they're related, that is permissible.
Yeah, great. Michelle?
Thank you. I think Amy covered some of what I was going to address regarding COFA migrants, so I'll let that go. The other item is with regard to HUD. that Native Hawaiians have different rules for its FHA program in HUD that limit their ability to refinance and access capital. I think it's a critical issue. While we talk about economic recovery after COVID, it's a long-standing issue, and would love to be able to hear from HUD on its equity plan and how we might address some of the inequity on a federal program and why it looks so different for Native Hawaiian communities on trust lands. And then I'll leave it at that. I think Amy captured the COFA migrant issues.
Michelle, that's great. And I think this is one of the, I've already heard 2 agencies that we should think about bringing to our next commission meeting, EPA and HUD. So thank you for that recommendation. It's a great point. Smita?
Thank you. Just one quick note is I know, could we please get copies of slides and some of the contact info from the presenters, because a lot of data that's been presented, that's fantastic. I'd love to get through a little bit more in detail and be very helpful. The one question that, there's 2 things I had a comment on. One, just in general, there's been this question about sort of uniformity amongst agencies about how we are going to, how everyone attacks, whether it's disaggregation or disseminates information. And I was just curious, how are we as a commission, are we going to become, it would seem to me to be a missed opportunity if we couldn't help generate some of that consistency and uniformity amongst the agencies. So is there a way, is that something we can do, or we can be sort of a place where people can come to ask questions, or we can help make recommendations on how all of the agencies are sort of have the one consistent process? The second question I had was on hate crimes and some of that piece of it. I know we've talked about physical crimes. I just want to make sure we're not leaving out cyber crimes. A lot of that is sort of the beginning. It's such a targeting can start so much earlier and then ultimately manifest itself into physical crimes. I want to make sure that's on our radar as we're pursuing that issue.
So Smita, great points. I think cyber is an important question. I think, again, we may want to think about inviting somebody from the DOJ cyber team to come in and give us some input on that, especially for the subcommittee. We being the subcommittee may want to think about that. And then regarding uniformity amongst agencies. So I think this is where the interagency working group is very helpful for us to interact with, because that is what the White House does, is they bring all of the agencies together to work through what they can and can't do. And again, each of these agencies, will have their own processes, but this is the point of working with the interagency working group. So we should think about how we want to interact with the interagency working group. I think you make a very good point there. Jen?
This is a slightly more meta point, but more just thinking about our role as commissioners, and just feeling like one of the most important things we could do is leverage this commission and our role to really communicate to our communities that this government is really interested in working for them, and there's a ton of work that is underway, and the more our communities engage, the stronger that work will be. But just in terms of this broader challenge of the relationship between our communities and the role of government, and strengthening that relationship as a explicit goal of this commission feels really important. And I just think there's so much good work that's happening and progress that's been made that people don't know about, and I'd love for us to have a stream of work that is specifically about communicating what government is up to, trying to do, and in the process of doing, that is in the service of our communities. As one of the, I feel like too often a lot happens and nobody knows about it. So just want to bridge that gap, because I think it's really important for the trust that we're ultimately trying to establish.
Jen, that is such an incredibly important point, and I think for all of us just to keep in mind, especially through the subcommittees, that that building trust between community and government is important, and that it's not us just advocating for community, but also being the bridge in between. So how do we do that effectively? How do we show how government works for communities and vice versa? How communities could use more help from the government? So I think the commission is super important for that. So thank you for raising that. Thank you for reminding us of that. That's important. Grace?
Somewhat building on that point and also diverging is the question, just, the last administration, did a lot that drove a lot of fear in our immigrant communities. And given the data that Karthik shared with us about who parts of our immigrant communities are, it would be really helpful to us to hear more, especially from DHS, around some of the efforts that they are undertaking to undo or provide redress to some of the harms to our communities that were elevated in the last 5 years or so. So I just want to make a plug for that.
Sorry, I think that's a great point, Grace. I think we can again add to for our next commission meeting, but also imagine that the subcommittee could do that also on hate, belonging, and inclusion. Sarah?
Mine is somewhat related to Ijen's point. I'm curious about what the distribution plan is on all of the information. So, for example, several people talked about how there were many websites that offered various resources, and that to me requires more of a lot of people to know that there is a website to go to and to be able to actually get there. And so I'm curious about the the divide between pushing and pulling information. And this goes back to Tung's point yesterday about related to misinformation and disinformation of how we're getting good information out to our communities, and whether that's through partnerships, whether that's through the media, or what Ijen is talking about is how do we create that dialogue to push the information out instead of putting the onus on our community to come find the information.
Yeah, Sarah, I think that's a great point, and certainly something we should be asking as we think about how to get the information out to our communities and ensure that they know where to go and not just what's available, but how to make it easier. I will say, I think this is sadly, this is part of the challenge that we're in the world, where there's just too much information and you're trying to understand which information is relatively good and which is not. And there's so much out there. So I think that's something we should keep in mind for all of our recommendations, but also in helping think through how we make it easier for our communities, especially given the diversity of our communities. So great point, and thank you for raising that. Mia, is your hand back up? I just wanted to make sure. Okay.
Yeah. No, I wanted to add on to what Ijen and Sarah were saying, which is it'd be great to hear from departments on what are their outreach plans, and understanding that it's better to go to the community rather than asking the community to come to you. And so thinking about what are the normal ways that our communities communicate with one another? How is misinformation disseminated? And then how can we transfer the information that we have out into the community to replace the disinformation? I think of it similar to relational organizing, which I'm sure some of you have very familiar with. But I think in terms of, particularly immigrant communities and other marginalized communities, a lot of it is through word of mouth. And so how can you tap into those sort of systems that are already in place to ensure that this information, that the right information is getting out to the people, so that, around COVID, et cetera, that people are getting in the information. I think lastly, I'm sorry for taking up so much time, is that thinking about in terms of when we translate materials, there's always going to be a delay in that. And that needs to be taken into account when delivering resources, because I think that's one of the major reasons why a lot of small business owners who don't speak English as their first language may have missed out on some of the resources that were put in place because it took a while for things to get translated. So that needs to be taken into account when delivering those resources, because it's unfair to give one group an advantage over another group. That's not equity. So I think that's really important for the administration to understand, is that, you know, if you are having to translate into different languages, that you need to translate them before you release the funds so that everybody has an equal opportunity to try and get those resources.
Mia, that is such a great point, and I think that's something that as the equity working group we should think about. Ajay, I'm going to hold on this because we really do need to get to the establishment of subcommittees. We have about 15 minutes before we go to break. So I want to make sure we look at the list of subcommittees that we discussed. I think we discussed sort of additional information and sort of things flagged for further inquiry together. And what I would love for us to do is to talk about the subcommittees, and again, we can come back to more inquiry within the subcommittees too. So please keep that in mind. But I'd love for us to talk about subcommittee and subcommittee chairs. So we have language access, data disaggregation, I believe anti-hate belonging team. I think that's something that we have talked about. And then economic equity and health, COVID and health and well-being. I know we discussed other subcommittees yesterday, if I'm not wrong. I think we discussed adding, immigration. I believe we had AA, NHPI diversity in the military, health equity and chronic diseases, disinformation, misinformation and communications, human trafficking. So I think there's things that we could probably put into broader context and then have the subcommittees look at details. So let me suggest an idea, and feel free to push back. This is just an idea. So anti-Asian hate, belonging, and inclusion. Could we incorporate the immigration work into that instead of creating more subcommittees, but have that subcommittee start looking into that? And would that be possible to do? Economic and small business, economic justice, small business. Can we also incorporate environmental justice into that? And are there other questions we could be asking in that? Potentially, could we put human trafficking under the health well-being subcommittee? So these are questions because they offer in different places, but it's just I'm suggesting, just because we're going to have to divide ourselves into subcommittees, and it's time that we're going to have to give in how we do that. So, Carrie, I know you have some questions here.
Well, I was wondering, with the urgency of this groundwater contamination, should it fold under one of these subcommittees, or can we simply assemble a task force to take immediate action?
I would highly recommend we put it onto a subcommittee, and the subcommittee can take it on quickly. I don't, if we start doing special task forces, we're going to be sitting and doing that for everything. So I would urge that we have a subcommittee whose job it is to, who's going to take that on to, maybe there's a subgroup within that subcommittee that sort of addresses that. But I would suggest that we put it into a subcommittee.
I'm good with that as long as we can move on it quickly.
So, sir, you should be on a subcommittee that can take that on.
I volunteer.
Naheed?
I'm really struggling because I completely understand your point, Sonal. Like, there's only so many people on this commission. There's a lot of different topics, but if I could just put in one quick note to urge that we not put immigration and hate, racism, and belonging together because of the particular challenge of white nationalism that I think is so enormous right now. It's everything from hate crimes to public official to it's so enormous, and quite frankly, anyone could argue this about every single category. I understand that, but I think immigration's so specialized and will require a lot of interaction with people at DHS and other folks working on it, and this is just a different animal. And so that's just a suggestion. I understand if it can't be done, but wanted to put a quick plug for not putting those two together.
I am just offering suggestions. Please do not take this as a requirement. I think I'm just trying to think about the time that you all have, and I want to make sure that we are also giving time to the things that we've been asked to do in the executive order. So please don't take this. If the group wants to move forward with that, we will certainly create a subcommittee on that, but I just want to keep that in mind. Louisa.
I was just going to make a plug for environmental justice. I think it's more appropriate that it's under some healthcare thing, because the things that our community has to deal with is the aftermath of a climate
Louisa,
disaster.
I think that is such a great point, and especially given the Dr. Balbus's presentation yesterday, I think that's a very good point. So let's move environmental justice into health. Amy.
Oh, I'm sorry. Thank you. I think immigration is a really, really big issue, and it could be a committee on itself. But if we needed to combine it, I would combine it with language access.
Thank you, Amy. Other comments on subcommittees?
Yeah, I have one comment, Sonal. There's so much, I don't want to get overwhelmed, and I don't think any of the commissioners want to get overwhelmed, but just looking at this list, there is a lot of intersections, right? I can see immigration and a bunch of other stuff, right? But I think we just got to figure out, how do we connect the dots? And sometimes maybe immigration is on a committee of its own in the beginning, and then maybe it gets folded in after the immigration subcommittee does some work on advancing solutions to the issues being faced. But this is a lot. And so I'm hoping that there's guidance from the staff and you, Madam Chair.
I want
to navigate this stuff, because it's a lot. Because with every issue, we also have to deal with what's the communication that we send out, what's the right message. It's a lot.
Exactly. Louisa, you are doing my job for me. Thank you so much. I'm gonna recruit you. I just want to again remind everyone that there is also a limited staff within the commission, and they have to staff all of us to get all of the meetings that we want. So I would urge us to think about how we work with the team that we have and to use as much as we can together. So the more committees they are, the more there's a limited number of the team sort of having to spread across all of us and request all of the meetings and do all of that. So I really do appreciate Louisa's point on this. So what I would suggest, and I suggest that we have fewer main subcommittees, and within the subcommittees, each of the teams figure out what are how you are going to prioritize which issues within that and where we can move. My one recommendation would be just to put it out from my experience in the past is if there are things already moving in government and we can tag on recommendations, it will help us move things faster. There are things that we should do that are medium term. We should continue to do to them, but there are some things like the equity task force that is moving and is going to make recommendations. We should really think about how we want to plug into that task, the task force and the recommendations that are coming out. So I would urge us to just think about prioritization within the subcommittees, but can we please think through how we want to limit the number of subcommittees, but also work that could go within the subcommittees. I don't think there's a right and a wrong, to be honest. I think if we want to do immigration within language access, immigration between belonging and inclusion, it's really up to us and how we want to approach that. I would urge us to have that conversation. And Dr. Underwood.
Yes, thank you. And, obviously this calls for great executive decision making on your part. Maybe you want to add some people to sort of help you out, but or maybe a special committee on committees. I don't know. But the thing is that, of course, there's a separation of issues versus broad categories of concern. And so, it's just kind of reminding ourselves that specific issues don't make a broad category of concern. But the one, I do want to make a pitch on immigration, and I want to explain this a little bit. It's immigration and citizenship status, because that's a kind of a political category. And that immigration and citizenship status hits on COFA. It hits on, I'm from Guam. I always tell people, I'm not an immigrant. The United States immigrated to us. And so that's a different kind of whole relationship. So there's a political status issue, there's immigration, and there's citizenship status. And that affects a broad swath of people. So I just wanted to make a pitch for that, and we'll see what you decide, Sona.
I see how you guys are doing this. Kimberly.
Thanks. I put my trust in you as well. I'm okay with moving the human trafficking, exploitation, gender-based violence into healthcare, but I know it crosses all the different sectors, whether it's immigration, citizenship status, the economics and small business, Asian hate and belonging. I know that there's a lot of federal government initiatives right now with the National Action Plan, the HHS Interagency Work Task Force, the National Advisory Committee. So, there's a lot of government work on it already. So I just want it to be somewhere. So you can put it wherever you want.
Thank you, Kimberly. I appreciate that. Kaying?
Yeah, I just want to put a plug in that I really don't want to take immigration and I guess citizenship status off, because the Southeast Asian American community has been, dealing with this issue for the last 50 years that we're here. And someone said yesterday the mass rounding up of Southeast Asians and then prioritizing, pushing deportation is a real urgent issue that we're dealing with on a daily basis that's impacting our health and economic as well too. And in the state of Minnesota, we have a lot of South Indians and Asian Indians and Chinese immigrants who were heavily impacted by H-1B visas during the COVID. And so all those issues are really urgent issues that really are harmful to the community. And so I don't know where you want to put it, but I don't think we should take it off the record, off the table. In addition, this is one issue that we can work in collaboration with the Latinx community, our African communities, and so forth. And every time there's an immigration debate, people in this country does not feel like we are at the table. If this commission does not even want to take on immigration, I think it's going to be a disservice to us in our solidarity work with other communities who have been heavily impacted by our immigration policies. And so I really just urge all of us to really think through, how do we incorporate this without really minimizing the impact that it's having on our communities globally, but also especially here in the United States.
Thanks, Kaying. And I want to reiterate, I'm not talking about taking immigration off. I'm just thinking about which subcommittee can own it. We're not talking about taking out immigration, not having a conversation on immigration. What we're really talking about, in the past, there have been about usually 5 subcommittees. And just as you've heard from the last commissioners, that is a lot of work with 5 subcommittees. Right now, we have 6. And so I would just keep that in mind as to, the limited staff we have that we can work, that this is a very small team. They have to do a lot for us. So that's including the next commission meeting and setting up all the commission subcommittee meetings, as well as helping get access to all of the meetings with the government officials. So I just it's more of a logistics question. It's not a question of whether we should talk about immigration or not talk about immigration. I don't think we should take it off the table. I'm not asking to take it off the table. I'm just asking, does it need to be a standalone subcommittee, or do we want to have it as part of one of the other subcommittees? That's the question. It's not to take it off the table. Please recognize that. Kevin.
So I just want to take a quick step back. So the reason why I asked the general question to Crystal and Emily, and like how many subcommittees were there in the past, I think we need to start just figuring this out mathematically a little bit. We have 23 commissioners. We have limited resources, limited staff. So obviously in the past, they had the maximum of 6 subcommittees, because presumably you wanted at least 3 or 4 people on each subcommittee. And I know people can be on multiple committees, but given just trying to schedule, once you get a really big subcommittee of like 7, 8 people, let's say, it can get unwieldy a little bit just to schedule, right? So I think if we want to be really nimble and effective, I think what we should do is figure out, are we going to have just 5 with at least 4 members on each? And then of course people can add on, and there can be more than 4, but at least at a minimum, each committee would, let's say, have 4. And then in terms of addressing which categories go into what, I think we're getting a little caught up in the semantics of, which overall arching name we're going to stick something else into. So for example, Sonal, you made a suggestion. You're just trying to get to limiting the number of actual groups. But if people are getting caught up on the name, you can just title it all in. So you can say, immigration, language access, blah, 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 10 different names to that committee. And then as the subcommittee gathers amongst themselves, they will sort out what they're going to prioritize, and people can move around. So it's really more of a procedural thing I think we should figure out, versus right now getting caught up on the names. And if something gets folded into something else, then it means it's being minimized and whatnot. So that's just my suggestion. Let's just work a little bit backwards. Let's come up with the 5 and then come up with the names, make sure we have at least 4 members on each, and then everyone else can add on. But as we know, our lives get in the way. We're all very busy people. And sometimes people might not be as active as they hope to be today, and they wanted to be on 3 committees. But at the end of the day, they might just end up being really active with 1, which is okay as long as we have 4 on each committee to spread the workload.
Kevin?
That must have been a mic drop, Kevin.
Oh, no, I'm here. I just stopped talking.
Sorry, Kevin. That was a great, I'm talking on mute, so I apologize. That is a very good comment, and I 100% agree with you. So let's make some decisions, and let's just talk about which committees we want. Let's just talk the top 5. Let's not do the sub right now, because we don't have, each committee can decide, but let's just go through that if we want to do that. So COVID and health, do we want to call it that? Do we want to call it something else? Or do we want to call it, I think Aijen put an idea in here.
Around health equity.
Health equity. Do we want to do health equity, economic equity together, or do we want to do it separate? Ajay?
They should be separate.
I think they should be separate.
Okay, great. Ajay, do you have any comment on that? You have your hand up.
No, I was just going to go back to the immigration discussion. I think for everybody's point of view, immigration is important, but one of the keeping the requirement or keeping the scope of the committees to a limited number is also important. So immigration, visas, and everything are tied to the business in a way. So could it be possible to consider bringing immigration under economic and small business? That's one of the options to consider.
Okay, so we've got lots of recommendations here. Health equity, economic equity is separating. Everybody good with that?
Yes.
Those
Yes.
are 2 committees. Okay. Anti-Asian hate and belonging. Separate?
Yes.
Yes. Right. Data disaggregation.
Yes.
Yes.
And do we want language access?
I like the suggestion about immigration, citizenship, and language access sort of grouped together.
Happy to do that. Is everybody good with that?
Yes.
Yep.
I hope that committee has a lot of time on their hands because you guys are going to be doing a lot of work and a lot of trying to get to a lot of meetings. But I want us to think about this for a second as you all think about that committee and that subcommittee and whoever's on it. Language access is moving in the federal government in certain places, and immigration, citizenship status are not always the same things. But I'm going to let the subcommittee figure that out.
I wanted to sort of bump what Naheed is saying is rather than saying anti-Asian hate, we broaden it out because our community faces a lot of different fronts. So something around racism and discrimination or something like that to be a little more inclusive. One of the things that I would love to work on a little bit around that is some of the ableism within AAPI communities. So I think it would be great if we could broaden that to be a little more inclusive.
So why don't we do belonging, inclusion, and hate? Mia, the only comment I would make on this is I know that the federal government's getting a lot of push on anti-Asian hate given what's going around in the country. And I think if we're not seen as even talking about it, they're gonna do things and we should be able to inform that. So, but you don't have to, I just put it out there. It's like, I know there's a lot coming in given the recent incidents, both in New York, Philadelphia, California, other places. So I don't think we have to start with anti-Asian hate. Maybe we start with belonging, inclusion, and hate and take out the anti-Asian hate piece of it. But I just want to keep that in mind. Victoria?
Yeah, I know we have kind of limited resources and just kind of the staffing, but I really believe that the immigration, I mean, these are 2 very important kind of topics. And I mean, I agree with you. I think it's a lot for one committee. And I know, I would recommend separating it out just because the language access work is just kind of cross kind of everything. And, the way it's going, I just feel like, we may have enough kind of interest, I believe, just from the discussion to have its own separate committee.
Why don't we just have a separate committee there? Language access, take that out of immigration and citizenship status. Can we get commissioners that are interested in each of these committees now so we can start putting names behind this? So who's interested in immigration and citizenship status? Jay? Who else?
Me, Simon.
Grace? Simon? Kai-Ying? Dr. Underwood? Sorry, can we get those names? And Amy? Do we have that, Jay, Grace, Kai-Ying, Dr. Underwood, and Amy?
Simon too.
Oh, Simon. Sorry, Simon. I don't see your hand up, so I see you're trying to put your hand up. If you can use your raise hand function, it just helps me collect all the information. I apologize. Data disaggregation. Kai-Ying, Dr. Underwood, Reynal, Sarah. Anyone else? Emily? Reynal? And then health equity. Victoria. Kimberly. Carrie. Teresita. And Kamal. And Michelle. Did we capture everyone there? Victoria, Kimberly, Teresita, Carrie, Kamal, and Michelle?
No, for some reason my function isn't working right now. But
sorry, was that Mia? Okay.
Yeah.
Mia. Economic equity. Ajay, Simon, Carrie, Michelle, Louisa, Kimberly, and Ijan, and Smita.
I had my hand up too, Kevin.
Oh, sorry, Kevin. Kevin. Your thumbs up merged right into the logo. Excellent. Belonging, inclusion, and hate. Louisa, Robert Underwood, Emily, Grace, Kamal, and Naeed, Daniel, and Mia.
I put my hand up there too. It merged again.
Yeah, Kevin, did I not say your hand's not showing up? So Kevin, thank you, Kevin, for speaking up. I really appreciate it.
But can we also just call that the belonging, inclusion, and anti-Asian hate / racism? I think that somebody
we can do that.
Yeah, I think that anti-Asian is important.
Yeah. And language access. Grace, Kamal, Daniel, Mia, Ajay, Victoria.
Sorry, my hand was up from the last one.
Oh, sorry, Daniel. Take Daniel off of that one.
Mine was up too on accident. It was from the last one.
Mia, take out Mia on this one, please, on language access. Not on the last one. Take out Daniel and Mia. Add Kimberly, Carrie, Amy, Simon. Anyone else that I'm missing? And apologies if I'm missing your hand. Great. Yes. Success.
Okay, standing ovation for our chair.
Success.
Sonal.
Kudos, everyone. I think we have a lot of work ahead of us. So what I would suggest as we move forward from here is we need really quickly, and I know I'm sorry we're into our break, but we just need to get going, keep going. Who would like to co-chair or chair immigration and citizenship status? Can you just raise your hands? The rubber hits the road. Grace. And Kaying. So let's have them co-chair. Data disaggregation. Robert and Renaud. I see your note, Kamal. Health equity.
2 islanders.
Hey, it's great. Carrie and Teresita. Economic equity. Ajay and Smita and Simon. Let's put all three of them. Belonging and inclusion. I believe Kamal had raised his hand for that. Louisa. Great. language access. All right, I'm going to go to people that aren't already co-chairing. So Victoria, Kimberly, and Amy. Ajay, I know you're already co-chairing one, so I want to make sure, because there's going to be a lot in each of these. So I know you can go back and forth in these, but I just want to put one. All right, are we good here? So just as we move forward, a few things to keep in mind. I think it would be good for each of the subcommittee, for the chairs to, co-chairs to prioritize what are the key issues that you want to work on in timing phase. What I might recommend to each of you is to think about what is already moving in government that we could access into now, as opposed to, and then sort of what's medium term and what's long term. So what are the things that you want to do, and thinking through that. So really appreciate y'all are taking that on. And then I think the team will work with you on making sure we can get the extra meeting. So one thing that co-chairs may want to think about is you can bring in experts to come with you on co-chairs. You can have experts come in and join your subcommittee meetings and give you informed input. You can bring in experts to help and work with you. So it's really up to you how you want to do that. But I think it's important that you know that you have access to bring in experts to inform decisions.
Sorry, this is Emmeline. I'm going to step in and just make a friendly amendment. So the subcommittee will need to assess how it wants to bring outside non-commissioners on into the subcommittee. So they have to come to a decision. So there's some criteria for choosing people.
Yeah, and I want to make sure that one thing I would highly recommend for each of the subcommittee co-chairs, or at least one of the co-chairs of the subcommittee, is know the rules from Emmeline as to what the process is. So we don't run afoul of the process. So please, if one of the members can, if at least one member can make sure they're working with. Mia, you had a question?
Yeah, no, I meant to put in that I'm fine with doing helping chair the health equity.
Oh, you would want to co-chair health equity?
Yeah.
Okay, great. Let's put Mia on there. And I believe Sarah would like to do data disaggregation, if we can add her there too. And Smitha would like to be included in the subcommittee on anti-Asian hate and belonging. Okay, everyone. Boy, you guys are going to be busy. Very exciting. This is great. I mean, I think this was the hardest, set of decisions and the things that we needed to do. I really appreciate everyone sort of working through the break to get us to where we are, and to really make sure we can get this in. I'm gonna blow right through break because we are really only about 10 minutes left, and I want to make sure we can finish up here. So topics for future meetings. Can we talk through? I did hear, let me tell you what I do have. We would like to have DHS, HUD, EPA come in and present, but are there particular topics that you would like to think about for the next commission meeting? That is not subcommission meetings, but this is for the commission meeting. Kayin.
Yeah, I wonder if you can bring the State Department or an agency that deals with immigration policies and things like that. Or US.
So again, I might suggest, Kayin, that you do that through the subcommittee first to understand what they're working on, and then. But I think broader as a commission, I would like if we can stick to the charge that we have, or where we could do that. But that's it's a good point. But I think you can do that also part of the subcommittee.
Okay.
Is DOD one of the agencies that the initiative works with?
I will ask Emmeline to step in here because I don't know the answer to that question.
So Crystal and Erica, they're on the IWG, if I'm not incorrect. Yeah, and Victoria's saying yes. So they actually are a member of the interagency working group that you learned about from Crystal yesterday.
So yes,
Carrie,
the answer is yes.
Specific, this is Erica. Is there something specific that you're inquiring about?
Yeah, I want to. I specifically want to know why they are impeding the Hawaii's health department efforts to save lives.
Again, Simon, Carrie, I would suggest that we do this through the subcommittee and have a conversation with them through the subcommittee. I think I'm just going back to what the full commission meeting, what do we want to, I think someone, Simon, I believe suggested treasury, which I think is also important. So happy to add that to the list.
Yeah, if I could just add, Carrie, and Madam Chief Commissioner, we also, because the next full commission meeting is not until May, the subcommittee apparatus to bring in the Department of the Navy or the Department of Defense to talk about Red Hill might be better done sooner rather than later, to wait for the next quarterly meeting, if that makes sense.
Yeah.
That does make sense. Thank you.
With all due respect, but also knowing the urgency of the issue, what's already in train, what Crystal and I have personally been involved in the interagency basis. I think that it may counsel us to not wait until May to want to engage that discussion on your behalf with the Commission.
Thank you.
Louisa?
Yeah. On the EPA, we know that the Trump administration basically dismantled that whole department. So I would like them to report on where are they in terms of trying to get all of the regulations that were off the books, but where are they in terms of making the EPA really the EPA?
Yeah.
And then also on immigration, right? There's the issues at the border, but where is the, whatever the department is, right? Where are they in terms of addressing the issues at the border, and what progress have they made? Because it's like radio silence on immigration issues, and it's just going to get worse.
Yep. So Louisa, I think there's two questions here, and I think that's a great point. So one, I think I have on the list DHS to come present to the broader commission meeting, and we can certainly do that. But there's also probably work you all want to do in the subcommittee to ask and to have conversations with the various parts of DHS too.
Okay.
Kimberly?
I was wondering if we could get like CMMS and NIH to come in and talk about their reimbursements, funding, LEP stuff.
Yeah, great point.
Grants.
Great. That's a different part of HHS, but I think it's a very good point. That's a Kai-Ying.
Hi. I don't know. This is way off the agenda, but in an effort to really dismantle white supremacy, I wonder if it's important for us to also reach out to our I think Crystal called it our sister agencies, like the White House Initiative on, Native Americans or Black communities, to just introduce their work and to see how we can all be working more intentionally together in the future. Because what we're trying to do is exactly what they're trying to do, and if we really truly believe that our liberation is tied to their liberation, then we need to really think about how to start that conversation right at this level.
That's great. Crystal, it might be good for us to think about how to have the other groups come here and present about what their priorities are and what they're working on.
Absolutely, we can make that happen.
That's a great idea. Ajay.
Yeah, I would love to have either part of the main committee or subcommittee, maybe have someone like Bharat Ramamurthy come back again, or and someone from Small Business Administration, as well as someone who could talk about federal grants, federal contracts, and stuff. So.
Yeah. It's a great point. What I might suggest is two-part on this one, Ajay. Part one, as part of the subcommittee, certainly reaching out to Bharat and having him, do some conversations with him as well as the SBA, but also think about what I think there's a broader question about access to grants and subcontracts across the federal government, and we may want to bring in someone that can talk about that. So why don't we sort of add in access to grants, funding, and contracting as part of a broader conversation?
Yes, Madam Chief Commissioner, this is Erica. We have some strong senior colleagues at the DPC who do that interagency work that cuts across all small business and access to contracting and equitable grant opportunities. That might be a good point of departure before we drill into individual agencies and departments, which could actually be too narrow.
Yeah, Erica, that's great. I think maybe the subcommittees also should meet with them, and then we can also bring them to the broader committee. I think that's a great point. Ijan? You're on mute.
Sorry. I wonder if the DPC and the Legislative Affairs Office could talk to us about some of the White House's policy priorities that impact our communities.
Dr. Kelsey, Dr. Kamal? Sorry, I was on mute talking to you.
You got to stop calling me doctor. There's a number of us, I guess, that are in government agencies, right? Like Dr. Vivek Murthy, Representative Kim. Do we have the ability to call on them where appropriate to come talk to us, or are we sort of embargoed from talking to politicos?
Nope, not embargoed. I believe it is a prerogative of the commission, your White House commission, to have those conversations.
What could be happening is
I think the challenge that you all may face is, sorry, Michelle.
Is there any issues? Could you kind of go through it?
I think somebody is on, not on mute. I think if you don't mind, Kamal, I think the thing to do here is, as we can ask and just ask for what
it was never created.
Am I still muted?
I'm sorry. I hope I answered your question. I think what we can do here is we can. You are welcome to ask, and you are absolutely. Erica, did you want to weigh in here, or Crystal? I believe, or Emmeline, I believe we can and we should if we want to.
I'm still muted, I think.
No, I can hear you.
HHS Dave? HHS Dave? Okay, great. Yeah, so absolutely that's in order, especially I think it would be a very productive session. Please let us know as staff. We can help to arrange those as good ideas like that come up. For sure, on the administration side and on the congressional side where we've got leaders, whether or not they're aligned with our mission and our work stream, we would love to facilitate that for the subcommittee or for our quarterly full commission meetings. And then can I address Ijan's suggestion?
Yeah, please.
Well, I think it's a great idea to get, that overview about not just how we're drilling into the commands of the executive order for the Asian American, Native Hawaiian, and Pacific Islander communities, but a lot of the work that I do day in and day out is making sure that national priorities that we read about every day, that are the order of the day in terms of negotiations and promotion and defense, are to make sure that those national priorities of the administration are inclusive of our communities and also impactful to our communities and communicated back out. And so I really like that idea of bringing in kind of the overview piece at the next meeting.
That's great. Yes, Amy.
I was wondering if we could hear from the Congressional Asian Pacific Caucus or something as to if they're doing anything on our priorities that we should know about, or we could give them information about. I think that was Crystal's last job.
That's correct, Amy. That was where I came from. I think we're still double checking. We think that there are ways for you to engage with elected officials. We're just going to have to double check and make sure, through our government rules that everything is all set there. But we will get back to you all. I know that that's a question that's come out about engaging with elected officials, so we will circle back with you on that.
Thank you.
So I also want to just remind the subcommittees, we are at time, but I just want to remind all the subcommittee chairs and subcommittees that we should also engage the regional network because there's a lot of information within the regional network, and there's a lot of ways for us to engage the regional network. So please, especially as we think about sort of how information gets out or how we bring information in, we shouldn't forget the regional network. All right, I think we have earned ourselves a break and some, I think the team, the White House team has earned some sleep. But I want to say thank you to everyone for powering through the last hour and a half and just really getting to the topics, making sure we have chairs and co-chairs, making sure we have everybody on different teams. And we certainly have a lot of work to do going forward. So super excited that we have launched and we are moving forward. Very excited about engaging with all of you. Thank you for being so committed and so engaged throughout the last 2 days for every conversation that we've had. And again, I just want to put in here, Kimberly's written it here, but a huge thank you to the White House team. They have been doing yeoman's work, and I don't think they have slept in at least a week. So let's thank them for everything that they've done, for the effort that they are putting in. But more than that, just the amount of time and thought they put into helping each person that was doing presentations to make sure there was an AAPI, NHPI component, and that was very much central to the conversation. So I really can't say enough thank you to Erica, Emmeline, Crystal, especially given all that she's taken on for everything that they have done, and for the whole team, Rebecca and everyone else that we're not even seeing here. So thank you for all of that work. And Crystal, I'm going to turn it over to you for any final thoughts, but I just want to say thank you to everyone for participating, and I'm really looking forward to the next couple of years with you all.
So much, Sonal, our Chief Commissioner. Can we all give her a round of applause too? She didn't have an easy task over the past 2 days, but managed to make it look very just so effortless. So thank you, Sonal, for your leadership as our Chief Commissioner and making sure that we are able to leave this meeting today with a very clear path forward. We have 6 subcommittees that this commission will focus on. And of course, these are not the only issues, but as has come up, many times throughout the course of the past 2 days, we really do. There is just an overwhelming amount of work and not a lot of time. So I really appreciate just everybody's help here to narrow down these 6 priority subcommittees that you all will be focusing on, and then also working on, as Sonal mentioned, figuring out what are the short-term, medium, and also long-term goals that you would really like to achieve through the work of the commission over the next 2 years that you will be serving as commissioners. We know that there is just so much, both in terms of immediate need and challenges, and I think that's come up over the course of this discussion. Lives are literally at stake for some of these issues, so we want to make sure that we can move quickly on the most immediate challenges and threats impacting our community, but also look at what are the longer term challenges and how do we also make change on some of these systemic issues that have long been barriers for our communities. So in terms of next steps, I think Sonal has outlined a lot of what we want to do. We discussed probably in terms of our next commission meeting, we have not set a specific date yet. I know we're still waiting to hear back from a handful of you on dates that work, but we are aiming to hopefully do this next full commission meeting in May during Asian American, Native Hawaiian, and Pacific Islander Heritage Month. And so we will keep you posted once we have a date confirmed for that. And then in the meantime, in terms of next steps, our staff will work with all of the subcommittee chairs. So we'll be reaching out to our newly appointed subcommittee chairs and make sure that we can start to set up meetings for all of you. And in terms of, the frequency of these meetings, we're anticipating they will likely be once a month. They can be more frequently, less frequently, depending, again, on the needs and the topics. But again, there is a lot of urgent work to do. And so we really look forward to working with all of you. And I know there's going to be logistically, we will help to coordinate schedules. We will help to make sure that we are the ones inviting speakers and reaching out to respective agencies, as well as our regional network and interagency working group to make sure that you have speakers there. In terms of, I know we talked about bringing on non-governmental experts to also potentially serve as resources to these subcommittees. So if you all have thoughts on that, if there are community leaders you would like to recommend, experts in their fields that you would like us to take into consideration to join or be a part of these subcommittees or bring in as speakers, please also keep us posted on that front. And so just want to really underscore that we are really here as a resource to all of you. We are a small but mighty team, and are here to make sure that we are making this work of the commission just as easy as possible. And I just really want to thank, in particular, Emmeline, our designated federal official, who has just been just amazing in terms of, working with so many of you, getting this commission off the ground. So we could not have done this without Emmeline. And again, I just want to thank all of you for your service. There's a lot of work ahead, but I feel just so energized after the past 2 days. We've had a really great discussion. We know that all of you are so engaged in this work, and the president could not have appointed a better set of leaders during this critical time for our community. So thank you so much for your leadership, and looking forward to the work ahead. With that, I will turn it over to Emmeline to close us out.
Great. It's lovely to see everybody. So we are going to convene a group of the subcommittee chairs at some point. So with that, I officially adjourn the meeting.
Bye, everyone.
Bye.